Today, I'm going to explain episode 1 and 2 of the series The Good Doctor, released in the year 2017. Dr. Sean Murphy is an autistic surgical resident. He is looking to move from his quiet life in his hometown to San Jose, California, to join the prestigious St. Bonaventure Hospital's surgical unit. Although autistic, Sean is an excellent surgeon with near photographic recall and the ability to note minute details and changes. In the beginning, he packs his luggage and says goodbye to his childhood home. On his way to the airport, he passes a football field and recalls the several times he was bullied but was saved by his younger brother Steve. On arriving at the San Jose National Airport, Sean is overwhelmed by all the noise. All of a sudden, some workers accidentally drop a glass board on a teenage boy, injuring him seriously. His parents run to his side, along with a man who claims to be a doctor. They see that the kid has been stabbed by shredded glass on his neck. The doctor uses a clean cloth to stop the bleeding, while Sean examines the situation from nearby. Everyone waits for the help to arrive in complete silence when Sean comments that the doctor is killing the kid. He further explains that the boy is not an adult, which means the doctor is putting pressure on his trachea and suffocating him. He rearranges the doctor's hand and looks for other injuries. Meanwhile, in the St. Bonaventure Hospital, a board meeting is held to discuss the arrival of an autistic surgeon. The president of the hospital, Dr. Aaron Glassman, has hired Sean and has known him since he was 14. He is the only one in favor of letting him stay as a surgical resident of the hospital. All of the other directors are skeptical because of Sean's medical history. Dr. Marcus Andrews, who is the chief of surgery, is strictly against hiring him. President Glassman tries to persuade the others by listing all of Sean's capabilities, but nothing he says satisfies them. In the meantime, Dr. Kalu and Claire are hooking up in one of the hospital rooms. They're disturbed when Claire is called to make a patient sign a consent form. As she is getting ready, Kalu mentions how no one knows about their relationship. To his disappointment, Claire claims that they are not dating just yet. Back at the airport, Sean uses his photographic memory of the human circulatory system to find out that the kid's lungs are in distress. This means that he will have to perform a procedure to let the air free that has accumulated in the space around the lungs. He goes to the security checkpoint to ask for a knife, but they refuse to give it to him because of safety reasons. With no way out, Sean snatches the knife and runs away only to be pinned down by security. The kid's mother explains to them that he is trying to save someone's life. Back in the hospital, Claire asks an older patient to sign the paper of consent for his heart surgery. The man is scared and wants to wait for a second opinion. Claire arranges for him to meet a psychologist to calm him down. However, her superior, Dr. Neal, asks her to get the signed papers immediately. When she tells him that the patient is panicking, the doctor asks Kalu to do it instead. It is clear that most of the doctors are practical, while Claire is more sympathetic towards her patients. Meanwhile, at the airport, Sean returns with 2 bottles of alcohol, a tube, and a knife. He disinfects everything and cuts a little hole in the kid's chest. Using the tube and the bottle of alcohol, he creates a makeshift one-way valve and lets free of the accumulated air, making the kid breathe again. Everyone claps for Sean, praising him for his quick thinking. The doctor beside him is amazed by his abilities. A flashback shows us that Sean was physically abused by his father during his childhood. After he was kicked out of 3 schools because of his condition, his father killed his pet bunny. Sean and his brother Steve took the bunny to the doctors where he met President Glassman for the first time. Following that day, the brothers started to live on a bus far away from their parents. One day, while playing in a warehouse, Steve fell from a high platform and passed away. This is the main reason Sean wants to be a surgeon. Back in the present, Sean and the kid's parents are in the ambulance when he notices a slight fluctuation in his heart rate. However, the paramedics refuse to believe him. When they arrive at the hospital, Sean tells Claire that the kid needs an echocardiogram. But since the report shows no fluctuation in his heart rate, she doesn't believe him. When he insists, the security kicks him out of the hospital. Dr. Neil Melendez and his team are treating the kid when he also notices the slight change in the heart rate. He and Claire quickly meet Sean and ask him why he said the kid needed an echocardiogram. He is brought back to the hospital and shown the results. On examining them, he quickly finds out that a piece of glass has entered the kid's bloodstream. According to his suggestion, the doctors perform the surgery and find the piece of glass in the kid's heart. Back in the board meeting, President Glassman says that he will give up his position if Sean fails to be a good doctor during the first 6 months of his employment. Yet, the board votes against his hiring. Before they can leave, the members are shown the viral video of Sean saving the kid in the airport. He is then brought to the meeting and asked why he wants to be a doctor. After pausing for a minute, he claims that he couldn't save his bunny and his brother when he was little, so he wants to provide other people an opportunity in life. Following the brief interview, an impressed board hires him. President Glassman sends him to his first official surgery under Dr. Neil Melendez. The doctor keeps him in charge of the suction and tells him that he doesn't belong in a hospital. Sean doesn't take his words to heart and in turn says that he has a lot to learn from him. He also asks Neil if his arrogance helps him to be a better surgeon. Everyone, including Claire, is stunned by his honesty. That night, Sean sleeps on the floor of his new apartment. He has set alarms that help him navigate his morning routine. He excitedly goes to work but is 5 minutes late because of the bus. He is in Dr. Neil's team of surgical residents. The group consists of Neil, Claire, Kalu, and Sean. Neil scolds Sean for being late on his first day at work and sarcastically mentions the board made the right decision. Sean, incapable of noting the sarcasm, thanks him. They are called to review the reports of a woman suspected of having a tumor in her abdominal area. On getting a look at the reports, Sean instantly finds out that she has a malignant tumor called sarcoma. The woman panics, thinking that she is about to die. The doctors bring Sean aside and teach him that although he should always be truthful while talking to patients, he shouldn't make them panic. According to Sean's diagnosis, the team gets ready for the surgery to remove the tumor. However, Neil appoints Sean to do the easier jobs around the hospital. Sean doesn't complain and instead says he looks forward to doing the scut work. He then continues tending to the patients with minor problems. However, he proposes to do several tests even for minor problems to be absolutely sure of the possibilities. The nurse assigned with him starts to get frustrated but doesn't say anything to stop him. A while later, President Glassman asks him why he isn't in the surgical ward. After finding out that Neil has assigned him to do scut work, he believes that Neil is doing it because of prejudice. Meanwhile, Claire is with the patient who is waiting for her tumor surgery. She is scared because she has to attend her son's wedding in 2 months. To make her feel better, Claire tells the woman that there is a very high chance of her survival, which is clearly false. Kalu belittles her for breaking the medical law, but Claire argues sometimes being truthful is harmful to the patients. Dr. Marcus tells Neil about the unnecessary tests that Sean is making his patients go through. He is keeping a close eye on Sean to see if he messes up. Sean, on the other hand, is treating a little girl who has come in because of a stomachache. Her parents do not stop bickering the entire time they are there. Sean requests several tests to find out the cause of the pain, but before it can be processed, Neil stops him. He finds out about the parents' bickering and says that the cause of the ache is probably stress. He asks the nurse to be Sean's mentor for the rest of the day and help him figure out what test is needed and what isn't. Sean is not satisfied with the little girl's results, but he agrees to do what Neil says. A flashback shows us that Steve and Sean asked for money from people to survive. Sean doesn't like to lie, so Steve does the task most of the time. Back in the present, he continues checking the patients under the nurse's authority. Meanwhile, Neil, Claire, and Kalu start the tumor removal surgery on the patient from earlier. To their surprise, the tumor is a lot bigger than they had anticipated, and they have no view of the organs. Sean is called to the operating room, but they only ask him to get the biopsy from the lab. He is a little disappointed that Neil doesn't want to include him in the surgery. At the lab, he asks the nurse to hurry up, but she simply orders him to wait. This reminds Sean of the time his brother had thrown a rock at a person's window to teach him he should be courageous. He tells the nurse he will throw rocks at her if she doesn't do it quickly. The woman laughs and asks him to wait for a few minutes. He brings the results back and examines them. While the other doctors conclude that nothing can be done to save her, he suggests they remove one of her healthy kidneys to get a clear view of the tumor. Later, Claire and Kalu are discussing the surgery with Neil when Kalu presents Sean's idea as his own. Neil compliments his quick thinking and decides to remove the woman's kidney. Claire is against the idea of removing a healthy organ because even that won't ensure her recovery. But since the majority agrees, they continue the operation. Against Neil's instruction, Sean runs several tests on the little girl who had an upset stomach. He finds out that she has intestinal malrotation, which can be fatal. Not thinking much about it, he rushes to inform her parents. They think he is a lunatic and ask him to go away at first. However, on checking, they find their daughter lying unconscious on the bed. They quickly drive her to the hospital while Sean gives her CPR in the back seat. Somewhere else, the tumor removal is successful and the woman is saved. When Sean arrives with the girl and does an ultrasound, he finds out she also needs minor surgery. Since Neil is busy, he goes forward to do it on his own, but is stopped midway. Neil thanks him for the help and asks him to go home. Dr. Marcus, on the other hand, orders Neil to bring Sean back to his team because he has proven he deserves to be there. Neil reluctantly asks him to be in charge of the suction. Later, Dr. Marcus and President Glassman bump into each other in the bathroom. Dr. Marcus bluntly admits that he is praying for Sean's downfall so he would get to be the next president of the hospital. The only reason he vouched for him today was to give him authority so he would mess something up. In the last scene, the little girl's parents are beside her, thankful that she is safe. When Sean walks in, they express their gratitude for saving their daughter. The episode begins with a man getting on his motorcycle while staring at three ladies passing by. He revs his engine, eyes still focused on them, and rides directly into an oncoming vehicle. Dr. Sean is inside his apartment, enjoying the serenity, when a knock on his door reveals a neighbor who needs some batteries for the controller that died in the middle of her game. He does a little introduction, and Dr. Sean gets her some batteries. She thanks him and leaves. Dr. Claire receives a call at the hospital and rushes to Dr. Sean, Dr. Kalu, and Dr. Neil to announce a liver. Dr. Neil mobilizes Dr. Sean and Dr. Claire on liver pickup while Dr. Kalu prepares their patient for the transplant. Dr. Marcus is getting ready for a breast reconstructive surgery when Allegra comes in and talks to him about his 4 p.m. VIP patient, who is close to making the foundation his tax relief if he aces the operation. She wants him to make Dr. Neil his second, and he's surprised that she doubts his abilities and emphasizes perfection. On the roof, Dr. Claire asks how Dr. Sean is doing with all the noise, and he admits he likes helicopters but hasn't been on one. Dr. Claire is upset that Dr. Kalu gets to go for the surgery while they pick up, but Dr. Sean isn't listening as he visualizes how the helicopter works. Dr. Kalu questions Chuck about how he feels when Chuck calls his daughter, stating he needs to see her. Dr. Claire and Dr. Sean arrive at the other hospital and learn the liver has been out of the body cavity for over 3 hours. Dr. Sean takes the liver out of the cooler, sees there's nothing wrong, and puts it back into the cooler. Dr. Claire calls Aaron and tells him about not knowing how to talk to Dr. Sean. He tells her not to try and think about what's in Dr. Sean's mind. Instead, she should find her way in if she wants to connect with him. With only 4 hours and 45 minutes left of viability, they realize they cannot go because the clouds are rolling in too quickly, and they could take a while to roll out. Dr. Claire opts for another ride and settles for a police escort to get the liver across town to the hospital. Dr. Andrews requests to see his patient alone and finds out Wanamaker hasn't quit smoking, but complains that he can't enjoy a drink of scotch with the massive hole in his mouth. Andrews explains he will graft from his leg to form a new cheek, but admits it won't be cheap, while Dr. Sean and Dr. Claire are still at the hospital with 4 hours and 14 minutes remaining. Dr. Sean tells Dr. Claire to tell Aaron that he might be late for their lunch together. When she hangs up, she makes small talk about his knowledge of the weather, but he can barely talk about it when the police escort pulls up. He stalls at the flashers and remembers a night when he was placed in a police vehicle, hitting the barrier saying, "He promised me." Dr. Claire asks the police to turn off the lights, and Dr. Sean recovers, carrying the liver. He wants to know the donor's name, and Dr. Claire says it's Oliver. Dr. Neil comes to Andrew's office, who offers to make time to help with the free flap, but Andrew says he is the chief of surgery. He says he's more concerned about making the hospital the first on the list. Andrews claims to be aware of the stakes, but refuses his help. Dr. Kalu returns to the pathology lab and says there isn't alcohol in Chuck's system. Dr. Carly disagrees and says blood doesn't lie. Dr. Claire and Dr. Sean are 17 minutes out when Dr. Sean looks at the x-rays. He tells Dr. Claire he has a girl neighbor, nothing more. Suddenly, the temperature increases, and Dr. Claire says they must find ice. Meanwhile, Dr. Kalu comes to see Chuck, who admits to having a glass of champagne 3 days ago at his daughter's graduation party. Dr. Claire and Dr. Sean find a store, but their ice machine is broken. So she begins to pack frozen vegetables as Dr. Sean is fascinated by the slushy machine. He remembers when the police intended to use him for child services. He turns to Dr. Claire, saying the frozen vegetables won't work, but blocks her out again. Dr. Kalu and Dr. Neil talk about Chuck and the champagne he drank. Dr. Sean tells Dr. Claire the liver has to be submerged to cool, so they fill the cooler with the slushy, but he doesn't answer any of her questions. She realizes he doesn't like questions, and both smile as the temperature begins to drop. Dr. Neil and Dr. Kalu realize Chuck was telling the truth and they can still work on getting the transplant. Andrews throws out his lunch and sits with Dr. Aaron asking for advice, who realizes that Andrews is upset that he is no longer the young star in the hospital. Instead, Dr. Neil is. Aaron asks if he is the chief of a top surgeon or a leader who wants to be president and advises that he has to take out his ego and act presidential for the latter. He walks away, biting into Aaron's apple. Chuck wants to know if he deserves the liver. He admits he hasn't led a great life, and he could have been a more remarkable man and dad. He admits to drinking too much and has an older son he hasn't seen in over 3 years. He sees the people waiting, knows their faces and names, knows they have stories, but still he broke the rules. He can't continue talking as he codes. Dr. Kalu checks Chuck and discovers he has blood in his esophagus. Dr. Neil comes in and together they bring his pressure up. In the locker room, Dr. Neil says he has 3 months to live at best. Dr. Claire jokes that she needs a police escort every day to work due to traffic. Dr. Sean grabs the x-ray as he remembers when he saw a photo of a liver while Dr. Aaron came to see him as a child before child services took him. Dr. Sean begins to feel the liver. Dr. Claire says she doesn't know what he's looking for. The scan shows no clot, but Dr. Sean can feel it. Dr. Claire confirms it must have happened before they stored it, and they tell the police they need to stop performing surgery. Dr. Sean and Dr. Claire perform surgery on the liver to remove the clot on the highway. Dr. Andrews talks to his wealthy patient, assuring him he'll be just fine. Dr. Neil talks to Chuck and his family about the progress of his liver failure. He says he has 2 to 3 months and realizes that Chuck didn't tell his family about alcohol, but he assures them that he'll do everything he can to convince the committee. His daughter runs after Dr. Neil, saying she gave her father the drink, and if he doesn't get the liver, she is the one who killed him. Dr. Neil tries to convince the committee about giving him the liver, but Andrews is against it, claiming that there are rules and the registry may not approve another case when the need arises. Dr. Claire and Dr. Sean arrive at the hospital, and Dr. Claire is told that another hospital is coming to pick up the liver. An ambulance pulls up and she hands over the cooler, after which Dr. Sean randomly mentions that the donor's name was Oliver. The ambulance drives off. Dr. Sean says it was a good day, that they saved a life, just not Chuck's. Meanwhile, Andrews is undergoing Wanamaker's surgery, but sends Mendelez to assist him. Chuck is all dressed with his family, ready to leave when his daughter walks up to Mendez. He assures her that it's not her fault, and she says she wants to believe that. She leaves, and he smiles at Chuck before he goes too. He stands with Andrews, who stares at the rich man trying to smoke after leaving the theater. They both leave. Dr. Sean gets home and stops at the neighbor's door, asking for his batteries. He calls them and asks for her name and also tells her his. He goes into his house and drops food for his cat before sitting at the dining table. He had flashbacks with Dr. Aaron when they wanted to have dinner before Dr. Sean took him for child services. The following day, he goes for lunch with Aaron. Dr. Sean is lying on his bed, struggling while listening to the water dripping from the faucet. He frantically begins to search everywhere in the house and calls Dr. Aaron over in the middle of the night, saying they will have to find it. Dr. Sean shows him the list he made, and the star screwdriver is on it. Aaron tells him there's a hardware store up the street, but Dr. Sean wants his own, so he panics and Aaron yells at him but soon apologizes. Aaron finds the screwdriver and tells Dr. Sean that he's overwhelmed and stressed. He advises making a list of things the superintendent should fix and tells him to go to bed. At the hospital, Dr. Neal shares with Dr. Kalu and Dr. Claire the case of a woman who is 26 weeks pregnant after 3 miscarriages. Dr. Sean runs in, saying she needs an ultrasound and an MRI to measure the tumor's growth rate. Dr. Neal questions Dr. Sean's tired countenance after having 12 hours off. Dr. Claire defends him, which ticks Dr. Neal off. During the ultrasound, they discover the tumor is half the size of the fetus, so Dr. Neal informs the parents that it'll be safer to terminate the pregnancy. The parents will do all it takes to save the baby and ask about fetal surgery. He tells her the health and fetal risks because of her condition. The mother isn't bothered about the consequences as long as the child survives. The husband insists they could try again for a baby instead, but Dr. Sean says they can use other medications to save the mother. Out of the room, Dr. Neal orders Dr. Sean never to contradict him in front of a patient again. Dr. Sean says they're not in front of the patient now. Dr. Claire suggests the same thing, so Dr. Neal tells them to get her prepared. Andrews is covering the ER for Dr. Audrey Lim and needs someone to lance a boil. He sends down Dr. Claire and Dr. Sean, but Dr. Claire protests that their idea convinced him about the surgery, and he is punishing them for that. Dr. Neal says he's only punishing Dr. Sean for being late, and she needs to go with him because she defended him and seems to know how to communicate with him. When they get to the ER, they realize her boil is on her labia, and Dr. Claire takes a look. The patient is experiencing unusual pain from a boil, and Dr. Sean suggests she could have flesh-eating bacteria. Dr. Neal speaks to Andrews about the surgery on his pregnant patient, and after questioning if his judgment is clouded, Andrew agrees. Dr. Claire examines Olivia and explains that the abscess is probably from an untreated chlamydia infection. Dr. Sean visualizes everything as she shrieks in pain. Dr. Sean offers to try. Dr. Claire tells her there's nothing to be embarrassed about, as Dr. Sean says 25% of college students contract STDs before graduation. She reveals she gets tested for STDs every 30 days because she does porn. Dr. Neal talks to his whole team about how vitally important the surgery is, but is interrupted when Jessica calls him out to speak. He meets with the father, who says he doesn't want to. Dr. Neal tells him that he doesn't have a veto over his wife's medical condition. Jessica informs Dr. Neal that a husband cannot stop him from operating on his wife, but he can stop him from working on his baby. Dr. Kalu and Dr. Claire talk about the patient's role in porn, when Dr. Sean pipes in, shocking Dr. Kalu that he watches porn. Dr. Neal tells Dr. Sean to go home and get some rest, also telling Dr. Kalu to go home too, since Dr. Neal put the fetal surgery on hold. The board meets to discuss their options and realize if they do nothing, the fetus and the mother will die, and if they perform the legally complicated surgery, they could both live. Dr. Neal returns and shares the news with the parents. Barb tells her husband Mark if he loves her, he will support her. Dr. Neal tells them to get some sleep for the surgery in the morning. Dr. Claire talks to Dr. Kalu in bed, saying it's hard to believe her patient does porn because she doesn't seem like the type. She tells him about working in a youth shelter, and all the sex workers have a certain vibe. He thinks it's a huge deal that she shared some personal stuff with him. She kisses him to shut him up. Jessica and Dr. Neal talk about the pregnant patient. She wonders why she wants to go through that process. The patient thinks it's selfish to put her husband through so much to have a specific experience when she could have it other ways. This conversation makes Dr. Neal wonder if she wants to have kids naturally with him. He's trying to be serious, but she says when they're in a meeting, he is never to call her ideas ridiculous. On the bus, Dr. Sean notices all the stickers of women dressed in lingerie and remembers when he found his brother looking at a Peepers magazine. Dr. Sean stands up and tells the driver that he missed his stop. The driver lets him off. Dr. Sean unwraps the plastic scalpel his brother gave him as he stands confused at the roadside. Lee notices Dr. Sean and drives them home. She talks about the gym, and Dr. Sean bluntly tells her she stinks. She says it's nice how he says what's on his mind and says goodnight to him. Dr. Sean bangs on apartment 23, and the super is furious for waking him up in the middle of the night, but takes the list. The following morning, Aaron and Dr. Sean are having breakfast, and Aaron says it's his fault for Dr. Sean taking what he said literally. Aaron retracts and says Dr. Sean is brilliant and needs to navigate how things go. He mentions a personal support worker, but Dr. Sean is pissed and yells he doesn't need aid. They quietly eat their breakfast. Mark talks to Dr. Neal and he says he doesn't know why Dr. Neal is desperate for the surgery, but Dr. Neal says he isn't hopeless but confident, which should make him feel better. Andrews praises Dr. Sean for his pelvis exam work and realizes he doesn't like being squeezed. He asks if Dr. Sean has ever had a girlfriend. Dr. Sean is curious if he's encouraging or mocking him. Andrews says he wants to know the right time for either, and Dr. Sean wants to know when it's a good time to mock him. They see the swelling isn't going down and realize there's a fibroid tumor wrapped around the nerve. They have to remove the cancer, but that means it will sever all feeling in her genitals. Dr. Neal begins the surgery. Just as he cuts into the uterus, her heart drops. He stops and informs the mother that she formed a blood clot in her heart, and they don't have any option but to terminate the pregnancy because the clots could affect her heart. The board meets again, and they want him to do the surgery again. Dr. Kalu interrupts with an idea. Dr. Neal and Dr. Kalu explain that they can stop her heart. It doesn't eliminate every risk, but it does reduce the biggest one. Dr. Sean returns home and knocks on the superintendent's door late at night and tells him he fixed the sink, but he wasn't supposed to touch it because it wasn't on the list. The superintendent tells him if he doesn't like it, to move and not knock on his door after 5 p.m. Dr. Neal and Dr. Kalu both work overnight on a plan for the surgery, as Dr. Sean, who also cannot sleep, visualizes the pipes in his apartment. In the morning, Dr. Claire and Andrews come to see their patient for her surgery. Dr. Sean comes rushing in, suggesting how to avoid all that. They do the surgery and congratulate both Dr. Sean and Dr. Claire for their excellent work. Olivia asks Dr. Claire to call her parents. Andrew says although Dr. Neal doesn't say it enough, they're both doing a great job, and they can always meet him if they need to talk. Meanwhile, Dr. Kalu and Mendelez successfully flush her heart. They perform her C-section. Dr. Kalu is mesmerized by the tiny fetus. Dr. Neal removes the tumor and puts the baby back. Dr. Neal ruins the surprise and calls the baby a boy as the parents smile. After the day is done, Dr. Kalu and Dr. Claire go out drinking and insist on bringing Dr. Sean. At the club, he has a flashback to when he was a boy and Colleen came to see him, acting friendly but making it a cruel joke. Back at the bar, he cheers both Dr. Kalu and Dr. Claire for the great day.
Kevin Wilkes arrives at his father's doorstep, but his father is upset to see him. He doesn't let him come in. Kevin's mother died 5 weeks ago, and Kevin missed her burial and failed to call his father because he was too busy in Thailand. Kevin hears him collapse in the kitchen and rushes him to St. Bonaventure, where Dr. Sean works. Dr. Sean arrives to work early this time, and Dr. Neal jokes about using a teleportation device. Dr. Sean replies sarcastically, impressing Dr. Neal and Claire, briefing Mr. Wilkes, Kevin's father. Mr. Wilkes has been diagnosed with having abdominal pain. While Dr. Neal briefs the team, Mr. Wilkes cries out in pain. They all head into his room except Dr. Sean, whose attention has been caught by a young boy with an arm injury who looks so much like his late brother Steve, who died in an accident. Dr. Sean looks on and remembers his brother in an emotional montage. After running a diagnosis on Mr. Wilkes, Dr. Kalu and Dr. Claire examine his results and develop theories about pancreatitis. Still, Dr. Neal suspects there's something they're missing and dismisses their ideas. He instead orders them to dig deeper. Dr. Sean heads over to the boy whom he learns is Evan Gallico and looks him over. Dr. Sean is determined to prevent him from dying. He checks his vision with a series of finger movements and orders a CT. Just then, Dr. Aaron Glassman comes by, expressing how much Evan looks just like Steve. He asks Dr. Sean how he feels about it, but Dr. Sean claims he feels fine. Steve is dead, Dr. Sean replies. Later, the residents come in to tell Mr. Wilkes that he has a lesion on his pancreas. It could be a benign cyst or cancer. Dr. Sean watches Evan as he enters the tube for a CT. They talk back and forth as Dr. Sean completes the scan. Dr. Sean talks about how his autism prevents him from understanding social cues, and Evan tells him he used to know a boy who had autism. The boy died in an accident. Dr. Sean tells him he also knows his brothers who died. Dr. Sean looks at the scans as they talk. Evan has a tumor on the side of his ear. Dr. Neal comes in, furious. He isn't happy that Dr. Sean took off and is conducting a scan for what he assumed was only a broken bone until he sees the scan. Dr. Sean heads out to the waiting room to meet with Evan's parents and breaks the news to them. But they already know, and they don't want Evan to know. They had already been told by a previous oncologist that Evan had only 1 year to live. That was 7 months ago. At lunch, Dr. Sean and Dr. Aaron sit and have lunch, talking about Evan. Dr. Sean thinks Evan should know about his condition, but Dr. Aaron tells him not everyone can handle the truth. Dr. Sean thinks Evan would want to see the truth. Dr. Sean has a flashback to when Steve wanted to know what he would get for his birthday, and Dr. Sean tells him, much to his brother's anger. Dr. Sean asks Claire Brown to come into Evan's room and tell the boy he needs pins since he cannot tell him the truth. Dr. Sean cannot lie to Evan. Dr. Sean then heads into the room to see Evan wrap his arm. Evan asks why Dr. Sean needed Claire to break the news, and Dr. Sean tells him Claire communicates better with people than he does. Evan knows Dr. Sean is lying about something. Dr. Sean then tells Evan he has cancer, but Evan already knows that. He tells Dr. Sean how he figured it out after Googling his symptom on the internet after recovering from a sore leg. His parents had bought him a PS4 after, so he knew something was wrong, because kids don't get gaming systems for growing pains. Evan tells Dr. Sean it's okay, and he isn't afraid to die. Evan asks Dr. Sean about Leia DeLallo, whom Dr. Sean claimed he liked. Claire and Dr. Sean talk as they work on paperwork. Dr. Sean is worried about Evan and is going over Evan's chart. Claire and Kalu discover that Mr. Wilkes has tapeworms in his brain. Kalu talks to Dr. Aaron, who used to be a neurosurgeon, and they come up with a game plan, assuring Mr. Wilkes of his safety with them. Dr. Sean is still working, and he cannot stop thinking about Evan. After going through a pile of books and charts, he discovers that Evan doesn't have cancer. The following day, Dr. Sean meets Neil at his parking spot and talks about the news. Still, Neil isn't optimistic and warns Dr. Sean against giving Evan and his parents false hope. Still full of optimism, Dr. Sean heads to see Dr. Aaron. Dr. Aaron tells him he can do some procedures without telling the parents and advises him not to get caught. Dr. Kalu talks to Mr. Wilkes, who's mad at his son for not taking over the family business. Kalu tells him that he also chose to be a doctor over his family business because he wanted to do what he loved. Dr. Sean sees Evan and pretends to carry out some procedures, but Evan can tell he is lying. Dr. Sean opens up about the possibility that Evan doesn't have cancer but wants to make sure, and Evan agrees it is worth a try. Evan's parents arrive suddenly and want to know what's going on. Dr. Sean can't lie, so he blurts out the truth. The father is angry and tells Dr. Sean to get out. Evan begins coughing up blood, and Dr. Sean calls for the nurses. Evan undergoes surgery, and Dr. Sean asks Neil to assist, but Neil refuses. Dr. Sean watches from the gallery as he and Dr. Aaron talk. If Dr. Sean is wrong, he's in trouble. Kalu sees Kevin in the waiting area and tells him that he needs to talk to his father and tell him the truth about his girlfriend and why he ran away. Kevin opens up to his father as he is wheeled into surgery. Kevin admits that he is afraid to take over the family business because he thought he would fail. Claire finds something in Evan during Evan's surgery and calls Dr. Neal over to see. Meanwhile, Dr. Sean waits with Evan's parents in the waiting room and has a flashback of when he gave Steve a book for his birthday, To Kill a Mockingbird. The surgery is over, and Neil comes out to speak with Evan's parents. He tells them that they discovered lesions on his ribs and that his osteosarcoma has metastasized into his chest. The news is heartbreaking, even for Dr. Sean, who listens. During Mr. Wilkes' surgery, Dr. Aaron locates the tapeworm in his brain and takes it out, impressing Kalu. Evan talks with his parents and tells them that he has known them for a long time. Dr. Sean watches from outside the room. Later, Dr. Sean and Evan talk, and Evan thanks him. Dr. Sean is upset that he was wrong and asks for a favor. He wants to read something to him, and Evan agrees. He reads to him the book he gave Steve. Evan listens. Afterwards, Dr. Sean leaves him with the book and thanks him for letting him read. He walks away with tears in his eyes. Dr. Sean and the rest of the crew receive a call that there was a massive accident, and 24 passengers are being brought in. The patients are brought in, and one has an object in his neck. Dr. Brown is assigned to her, but she is fidgety. Dr. Neal assists her. Dr. Sean is tensed as a patient with a damaged artery on the leg is brought to him, prompting Nurse Friday to grab his arm, but he pulls back, confusing everyone. After a moment, Dr. Sean calls out all the medical supplies needed, and everyone wonders what Dr. Sean is doing. He tells them he's making a Reboa to occlude the damaged artery and stop it from bleeding. The patient stabilizes and everyone is impressed, including Dr. Aaron. Dr. Marcus stops Dr. Kalu from misdiagnosing a burn patient and operates on him himself. Dr. Glassman is examining a patient but doesn't have an ultrasound machine, worrying Dr. Neal, who thinks he might pierce the man's heart. Still, he proceeds anyways and laughs as Dr. Neal mentions that Dr. Sean's Reboa could have gone really wrong. Glassman asks him how long Sean will have to prove himself to him. As Dr. Neal and Dr. Claire prepare for surgery, he understands that this was her first trauma, but reminds her she needs to think a little more like Sean. Dr. Kalu is removing the burnt skin from Celeste, his patient's neck. Celeste is crying about her condition and demands a mirror since Dr. Kalu won't even look her in the eye. She wants to know how bad it is, sobbing at the image. Dr. Neal takes Sean to Marco's family to tell them the doctors cannot fix the leg, and their only choice is to amputate it. His bride breaks down crying, as this is their wedding day. In the ER, Sean wants to use one of the computers, but all the doctors take them before he can get to any. Jessica Preston and Neil are asked about their plans for marriage, but they haven't figured it out. Jessica prefers a beach wedding, but Dr. Neal's family likes churches better. Dr. Aaron listens just as Dr. Sean rushes off after Nurse Friday asks him if he wants to love, and he says no. Sean finally finds a computer but has to beg Dr. Claire for it. He begins to visualize any options to save his patient's leg, but there are no options. Claire suggests replacing the entire femur, and they get to it, while Dr. Neal watches as they build a femur out of titanium. Dr. Neal is undecided about their suggestion as he needs to think on this, but still has 7 trauma tags to deal with. Claire tells Dr. Neal it was her idea, but he doesn't believe her. He has a hard time believing she's brilliant because he's known her for 6 months. Dr. Kalu is confused about what to say to comfort Celeste, so he sits outside alone. Dr. Claire suggests that he doesn't need to talk, but listen to her because she is afraid, and he is her only escape. Dr. Neal and Dr. Sean go to see Marco's family about implanting the fake femur on Marco. Dr. Sean tells them it's the first time that he's doing this surgery and admits there is a 10% chance of dying. Marco's mother immediately refuses, but his fiancée says Marco would want them to take the opportunity. Dr. Neal says his parents are the next of kin, and they are the ones who decide, so Marco's father tells them to amputate his leg. While Dr. Neal and Dr. Sean prep for surgery, Dr. Sean asks why having someone to love is so important to everyone when Dr. Neal's wedding comes up in their discussion. Jessica enters and tells them they can't go forward with the surgery because she has filed an injunction to stop it. Claire talks to her parents, Numi, about the neck surgery and how lucky she is to be alive. She extubates Numi and she asks about her wife, Jenna. Claire checks the list with her and Jenna's name isn't on it. Jessica tells Dr. Neal that Judge Singh is en route. Still, Dr. Neal reminds Jessica that Marco's parents' decision is not his fiancée's. Still, she objects when he says all parents love their children no matter what. Jessica gets defensive, wondering if Dr. Neal would want his parents to make such decisions over her. While they argue, Dr. Sean reminds them that they have 3 hours before Marco's leg will die. Dr. Kalu returns to Celeste and offers to show her a movie, but she says a funny film won't change this for her. She mocks him about having all the answers for her. Meanwhile, Marco's parents and fiancé meet with Judge Singh, and they debate replacing Marco's femur. Marco's fiancé reveals to his parents that they met at rehab where Marco was recovering from his drug addiction. Claire learns that Jenna hasn't been around since the accident and suddenly realizes Jenna could still be at the crash site and goes back to find Jenna. Claire finds Jenna unconscious. Dr. Kalu talks to Dr. Andrews about Celeste, who is eligible for an experimental burn treatment with tilapia fish skin. Still, Dr. Andrew tells him the process for approval could take 3 months. Dr. Kalu was hoping he could expedite it to 2 hours. Dr. Andrews, however, applauds his initiative. Claire arrives at the hospital with Jenna, whom she has administered some first aid treatment. Dr. Glassman tells Claire she made a good call. Dr. Kalu returns to the isolation room, informing Celeste that the tilapia skins are going to the hospital. She won't need skin grafts. Dr. Sean is brought in for questions by Judge Singh, but he is so slow to respond, frustrating everyone. Dr. Sean notices Marco's toes are changing color and instructs them to call Dr. Neil as he is clotting. Judge Singh decides the titanium femur be implanted on Marcos since his parents know him only as their child and may be irrational. In contrast, his fiancée knows him as a man. Dr. Glassman allows Claire to perform the surgery on Jenna with him, but she does not survive. Dr. Kalu begins to lay the tilapia skins on Celeste, just as Dr. Sean helps Dr. Neil with the surgery on Marco. The surgery worked, and the family is grateful for saving his leg. Dr. Kalu tells Celeste her tilapia skin is only for 6 months, allowing her new skin a chance to grow in with minimal scarring. She thanks him, admitting she misjudged him, but he says she judged him right. Claire watches her parents sleep when Dr. Glassman comes in, realizing she hasn't told her that Jenna is dead. He takes Claire out of the room and tells her she made a mistake that cost Jenna her life. Claire screwed up Jenna's intubation. Dr. Aaron tells her to go home and get some rest. Dr. Andrews joins Dr. Kalu in the elevator. We learn that Dr. Kalu donated to the burn unit of the San Diego Community Hospital to get Celeste's experimental treatment. Dr. Aaron informs Numi that Jenna has died, and Claire watches. Jessica and Dr. Neil kiss as they leave the hospital. Outside the hospital, Dr. Aaron and Dr. Sean talk about him not wanting love, and he mentions that he loved his brother and his rabbit. Still, they're dead, and so he can't love them anymore. He reaffirms that he doesn't want to love, and they go get breakfast. We begin the episode with Dr. Sean staring at some brand new TVs on his way to work. Meanwhile, at the hospital, Dr. Aaron comes by to see Dr. Claire to see how she's doing. Dr. Claire says she's dealing with her pain by getting back to work, but he insists she go for grief counseling. Dr. Neil arrives at the ER with Dr. Lim, where they meet a patient with a broken pacemaker. Dr. Sean says the patient cannot have a transplant due to his age, so he will inevitably die. Dr. Kalu suggests cardiac synchronization in order to make the patient feel better for the few months he has left. Claire is ordered to cut the patient's jugular, but hesitates. Dr. Neil asks what's wrong, and she lies that she drank too much coffee. Dr. Sean notices the EMS bringing in a wounded young autistic patient, and they strap him down. He's autistic and doesn't like being touched. Dr. Sean cleans him up, and the patient learns Dr. Sean is like him. The patient's name is Liam, and he wants his hands released, so when his parents arrive, they release his hands. Liam's mother is shocked that Dr. Sean is his doctor because of his autism. His father asks if they can take him home, but Dr. Sean says he shouldn't. Dr. Kalu tells his patient, Glenn, that a pacemaker is being flown in, and that they will prep him for surgery when it arrives. Dr. Sean explains Liam's condition to Dr. Neil, and Dr. Neil instructs him to do an RCP to clear him, but Dr. Sean disagrees. As Dr. Claire is filling out a psych questionnaire at the nurse's station, Dr. Sean interrupts her and asks if she can help him with the RCP since she's good with autistic patients. Dr. Kalu returns to Glenn's room and realizes Glenn is missing. Claire gives Liam the sedative and he has a respiratory reaction to it, but Dr. Sean can calm him. As Dr. Claire proceeds with the test, she asks if Dr. Sean is happy to interact with an autistic person, but Dr. Sean doesn't feel that way. They're interrupted when they realize the patient has a lot of scarring in his digestive system. Dr. Sean reports Liam's scarring to Dr. Neil. They cannot do an MRI or give him a sedative because Liam could die, but Dr. Sean eventually convinces Dr. Neil that they should do an MRI. Dr. Aaron finds Dr. Sean pacing the floor of Liam's room. Dr. Sean wants a $1,643 TV, but Dr. Aaron reminds him that he's not a surgeon yet, but only a surgical resident, and his paycheck cannot afford it. Dr. Kalu learns Glenn got onto the freight elevator, but there were no cameras in the elevators, and some of the floors that the freight elevator goes to also lacked cameras. Dr. Claire is on the elevator when she gets a text from Dr. Aaron reminding her about her appointment for noon. As she's about to respond, Dr. Kalu gets on the elevator and lies that he's looking for a pediatric patient's blanket, but Dr. Claire knows why he's there. Liam is placed in the MRI, where Dr. Sean helps him concentrate. Liam responds to Dr. Sean as they attempt to start the test. It's going well. Liam suddenly begins to panic and hits his head. He's pulled out of the MRI immediately. Dr. Kalu searches the basement for Glenn. He finds Glenn, who reveals he broke his pacemaker on purpose in order to die. He asks Dr. Kalu to leave, but Dr. Kalu stays instead. Since there's no other option, Dr. Neil gets Liam's parents to sign the papers for Liam's surgery. Dr. Kalu is waiting for Glenn to pass out so he can get him upstairs before he dies. Glenn says he has already lived, married, and loved. Now he's alone with no home. Dr. Kalu talks about being sent to boarding school and later abandoned by his parents. Dr. Claire tries to calm Liam down, and Dr. Sean begins to speak to him. Dr. Sean discovers the cause of the scarring in his bowels. Liam's mother thanks Dr. Sean for diagnosing their son, but doesn't want Dr. Sean in the surgery. Dr. Aaron tells Dr. Neil that if he cannot convince Liam's parents that Dr. Sean can handle surgery, he needs to tell them to find another hospital. Dr. Kalu continues to talk to Glenn, but Glenn has no response. He checks Glenn's pulse, but Glenn says he's still alive and wants to know what happened with Dr. Kalu's parents. He assures Glenn that he isn't alone, and Glenn expresses his gratitude for Dr. Kalu's help. Dr. Claire goes to her counseling session but lies about her emotions and state of mind. Dr. Neil meets with Liam's parents, who are worried that Dr. Sean won't be able to help Liam. But Dr. Neil assures them that he has complete confidence in Dr. Sean. The parents still refuse until Liam says he wants Dr. Sean. Glenn's pacemaker arrives, and Dr. Kalu tells him he will return when he's ready to put it in. Glenn admits his wife left him and states that Dr. Kalu didn't deserve what happened to him. Dr. Kalu smiles and holds his hand briefly. Dr. Mohan, the counselor Dr. Claire is seeing, is concerned and advises her against suppressing her feelings as they will eat her up. Dr. Kalu returns to Glenn's room, but Glenn is gone again, and Dr. Kalu searches for him once again. Dr. Sean arrives in Liam's room, but as he expresses gratitude, Liam's pressure is bottoming out, and he's going into septic shock. Dr. Neil offers the scalpel to Dr. Sean, who takes it and performs the incision. This reminds him of his brother's toy scalpel. Glenn's location is announced, and Dr. Kalu rushes off. Meanwhile, Dr. Sean cannot move as he has found the perforated spot. He wraps his hands around it, and Dr. Neil orders Dr. Claire to slowly cut it open so he can extract the septic contents and flush it with antibiotics. Dr. Kalu finds Glenn on the roof. He plans to commit suicide. Dr. Kalu once again sits beside him, but Glenn tells Dr. Kalu to leave as he cannot help him. Dr. Kalu refuses to give up on him. Dr. Sean and Dr. Neil assure Liam's parents he will be fine. Liam's mother hugs him, and she quickly apologizes. He says she shouldn't feel bad, as they love him and did what was best for him. He makes a joke, and Dr. Neil smiles. Dr. Kalu sits with Glenn, who signed a DNR. He gives Glenn a morphine dose to help with the pain, and Glenn thanks Dr. Kalu as he dies. In the locker room, Dr. Kalu walks in and tells Claire about his patient, and Claire opens up about her suppressed feelings about the death of Jenna. Liam's parents watch over him. Dr. Sean tells Liam that he will walk around in 2 weeks when the antibiotics have cleared his infection. Dr. Sean smiles as he sees Liam and his parents together. Dr. Aaron and Dr. Sean watch football as Dr. Aaron teaches Dr. Sean about online banking and budgeting. Dr. Sean wants to go to the Super Bowl, and Dr. Aaron suggests they should both go. Suddenly, the salesman informs them that it's almost closing time, and Dr. Sean tells him he wants to purchase a TV. The salesman allows them to stay, and they recline their chairs and chill out. The next day, Dr. Sean's neighbor, Leah, comes over to his apartment, complaining about their landlord as Dr. Sean prepares for his day. She takes a bite of his apple, which he carefully selected, before storming out, offended that Dr. Sean didn't support her position on the landlord matter. Dr. Sean stops at a market to replace his apple, but the market gets robbed, and Dr. Sean does not comply with the robber's demands. The robber shoots, and a female customer is injured. The robber is then smashed across the neck by a man with a baseball bat. Dr. Sean, unharmed, escorts the injured woman and her date back to the hospital. The robber is also brought in as the bat has injured him. The woman's date spots Dr. Sean and blames Dr. Sean for the incident. Dr. Neil tells Dr. Sean to go home after giving his statement to the police, but Dr. Sean doesn't leave. He wants to help, so Dr. Neil allows him to stay. Dr. Neil returns to his patient with Dr. Kalu, while Dr. Claire and Dr. Lim operate on the shooter. Dr. Claire is uncomfortable helping the shooter, especially after noticing his Nazi tattoo and the disrespectful way in which he spoke to Dr. Lim, having ordered Dr. Claire to leave the operating room and send for a replacement. Dr. Sean is now in the OR with Dr. Neil and Dr. Kalu, operating on the gunshot victim. Dr. Sean begins to suture the wounds. The patient is stabilized for now, but the next 24 hours will be critical. Dr. Claire's Nazi patient also survives the surgery, and Dr. Lim puts Dr. Claire on babysitting duties, much to her displeasure. Dr. Sean has a meeting with the hospital's psychologist, who assesses him but cannot determine the effect of Dr. Sean's involvement with the gunshot victim's treatment on him. Dr. Neil monitors the gunshot patient and notifies her boyfriend that the possibility of organ failure is high, and she needs someone to sign consent forms. He also mentions that he should contact her parents, but he can't because they had only just met, and she didn't bring any means of identification. Dr. Neil tells him that he doesn't need to be there and will contact social services, but he refuses to go and is permitted to stay. Dr. Claire checks her Nazi patient and discovers he is a drug addict, as he has built a tolerance to pain medication. He needs fentanyl, but Dr. Claire refuses, and he lashes out. Dr. Aaron is not satisfied with the report of the psychologist's session with Dr. Sean. He's concerned about Dr. Sean, but the psychologist says that she has had only limited opportunity to observe him. Dr. Claire talks to Dr. Neal about Dr. Lim's actions, but Dr. Neal tells her to do exactly what Dr. Lim tells her to do. Later, Dr. Sean and Dr. Claire talk about his apple and that morning's incident, and Dr. Claire tells him Leia probably wanted his support, not advice. Dr. Claire is summoned and leaves to check on her Nazi patient. The Nazi has pulled out his IV, annoys her, and undermines her professionalism. Dr. Sean doesn't want to talk about what happened earlier and returns to check his patient, the gunshot victim, under the watchful gaze of her date. But the date does not trust him. Dr. Sean discovers the patient's legs have grown big and she needs dialysis. Dr. Neal and Dr. Sean perform the dialysis, but her organs will continue to fail until her heart stops. Dr. Neal berates the date for antagonizing Dr. Sean, whom he doesn't even know. Dr. Claire walks into Dr. Lim's OR and confronts her again. Dr. Lim doesn't like her authority and professionalism being undermined, as Dr. Claire would never disrespect or disobey Dr. Neal this way. She orders Dr. Claire back to her Nazi patient. Dr. Aaron catches up with Dr. Sean and talks to him about what happened. Dr. Sean, upset, says he's not the cause of the girl's gunshot wound. Dr. Aaron insists Dr. Sean's actions may have led to the incident, and Dr. Aaron feels he needs to support Dr. Sean more and help him if need be. The gunshot victim's date opens up that it was his fault that Dr. Sean's patient got shot. He was trying to ditch her. Dr. Sean tells him it's not his fault as his patient begins to experience some complications. Dr. Claire's patient has difficulty breathing, and when she removes the bandage from his neck, she discovers his neck is swollen. Dr. Sean's patient is at end-stage organ failure, and Dr. Neal has to decide between Dr. Sean's and Dr. Kalu's theories as to why the patient's neck was swollen. He goes with Dr. Kalu's, heading back to the OR. In the OR, the surgeons discovered that Dr. Kalu was right. Dr. Sean's patient is bleeding internally, but they can't locate the source of the bleed. Dr. Sean uses his photographic memory to visualize the bullet's path and stops Dr. Neal and Dr. Kalu from cutting her open, believing he has found the bleed. Dr. Kalu pages for Dr. Lim, but she doesn't arrive on time. Dr. Claire has no choice but to perform surgery there and then. She grabs a scalpel, but the extreme swelling obscures the patient's Adam's apple. She makes an incision even when she doesn't know where to cut. As she finishes up, Dr. Lim walks in, taken aback but pleased it went well. She asks for him to be taken to the OR to finish up. In Dr. Neal's OR, Dr. Sean indicated where to look for the source of the bleeding, and he's correct. The patient is stabilized, and Dr. Neal applauds Dr. Sean's miraculous ability to locate the bleed. The gunshot patient survives and her parents have been located. Just as her date leaves, she thanks him and admits she thought he was trying to ditch her. The date looks somewhat relieved and asks for a second chance at another date when she's better. Dr. Claire walks into Dr. Kim's OR and makes a public apology. Dr. Lim accepts Dr. Claire's apology and jokes about the day's victory being a Nazi. When Dr. Sean is finally home, Leia knocks. He apologizes for not taking her side in the morning, and she gives him an apple as a peace offering before leaving. After a brief moment, Dr. Sean heads to her apartment and knocks. Leia answers, and he talks about his day. Leia wordlessly hugs him, and although he doesn't hug her back because he doesn't like to be hugged, her embrace relaxes him.
A team of doctors is operating on a sick boy while his mother sits at the reception, beating a kind of drum. The surgeons notice a complication in the boy's heart, and his heart rate starts to rise. Will he survive? Is the operation successful? At the reception, Dr. Melendez feels Aoki, who isn't even a doctor, should have stuck with the list of candidates selected, as Gabriel wasn't one of them. Still, she tells Melendez that several intangibles made her choose Gabriel instead. Melendez mentions that cuteness and sob stories would work on donors, but not on medical results, and certainly not on him. He's very upset. Dr. Mehta disagrees with him, and Aoki suggests that Melendez do his own workup before making his final decision. Later, Dr. Marcus Andrews and his wife, Dr. Isabel Barnes, walk into a ward to see a patient named Elizabeth McLaren, a podcast host. Elizabeth comments on how Dr. Andrews and his wife work together like ping and pong. Dr. Melendez and the intern team comprising Sean and Dr. Mehta visit Gabriel. While Dr. Melendez examines him, Dr. Mehta insists that Gabriel really needs their help. When they are in the hallway, Melendez mentions that the condition of Gabriel's chest is hopeless. Still, Dr. Mehta insists that they do all the tests before they conclude Gabriel's case is indeed hopeless. Moments later, Sean is in with Dr. Glassman, upset that Sean turned away the housekeeper because her clothes didn't match. Isn't that ridiculous? Dr. Glassman says if he learns how to interact better with people, Sean would be happier, but Sean walks away, insisting he's happy. Later, Sean and Dr. Claire walk into a ward with the machine for Gabriel. Sean tells Claire about his neighbor, Leah. He thinks Leah doesn't like him because she called him an asshat while touching him. Dr. Claire tells him that Leah was flirting with him because when flirting, some people say the opposite of what they mean. She gives him tips to look out for to know she's flirting. Dr. Andrews and his wife enjoy their dinner when they receive a call that Elizabeth's specimen has been misplaced. Dr. Andrews assures her that they will find it. Claire searches for the specimen in the pathology lab as she has seen it placed in the specimen bottle, but she's told to check back with surgery. Sean is with Dr. Melendez, who realizes Gabriel's condition is worse. Dr. Mehta apologizes for pushing for further testing. They suggest a medication that could give Gabriel a couple of years of life. Melendez plans to break the news to Gabriel's mother and asks Dr. Mehta to tell Aoki the discovery. When Dr. Melendez arrives in Gabriel's room, he sees his mother playing the drum. She tells him that her shaman instructed her to tap it to remind Gabriel's heart to beat until the doctors fix it. She mentions that her shaman told her a stronger healer would save Gabriel, and she believes Dr. Melendez is the healer. Dr. Melendez informs her son has a heart he cannot fix. She insists that they wouldn't have come so far with a heart she didn't think he could fix. Dr. Claire's search for Elizabeth's sample is hopeless, so Dr. Andrews and Jessica Preston inform Elizabeth that they cannot find her specimen. Elizabeth is worried that her voice box will be removed if they don't find it. Sean tells Dr. Glassman that he's taking flirting lessons, and Dr. Glassman is surprised. He asks if Sean feels lonely, but Sean says he likes to be alone, and the conversation gets switched around. Sean learns that Dr. Glassman is lonely. Dr. Claire and Dr. Carley hunt around the hospital for Elizabeth's specimen. After scaring Leonard, he reveals he stopped at the cafeteria for a little while. Dr. Kalu is packing up Gabriel's things when Gabriel's vitals suddenly drop. Dr. Kalu calls for help as she begins to tap her drum. Sean and Dr. Mehta come to examine Gabriel. Sean suddenly has an idea and chases after him. Meanwhile, Claire and Carly go to the cafeteria, where Gwen hands them the biohazard bag, but it is not Elizabeth's sample. Dr. Melendez tells Sean to share his idea with Aoki. Sean explains to Aoki the procedure that could save Gabriel's life. Still, Dr. Melendez feels otherwise and mocks Aoki for trying to make decisions for him. Sean wonders if fear of failure is a good reason not to try the procedure. Dr. Melendez hopes Gabriel will survive. Elizabeth argues with Claire about the missing tissue specimen, but Elizabeth hugs and thanks her when Claire apologizes. Dr. Melendez is impressed and promises not to reveal that she broke the rules. Melendez confronts Gabriel's mother about Gabriel's medications when Dr. Mehta mentions that the medications aren't working. Dr. Melendez discovers Gabriel's mother has been withholding the medications to keep Dr. Melendez from sending Gabriel home to their uninhabitable village to die. She says she wants to hope, and Dr. Melendez agrees to do whatever they can. At dinner, Dr. Andrews and his wife ask about Elizabeth. He feels he did the surgery correctly, and anything after is not his problem. His wife is angry that he's campaigning to be president of the hospital, leaving her far out of his life. Dinner is ruined. Dr. Claire has drawn the trips of each specimen and where they all go on a whiteboard. Sean walks in and presents a chart about all the flirting he's noticed in the hospital. He insists that Dr. Claire was flirting with Dr. Melendez earlier, as he had seen her make a few flirty gestures. Dr. Claire denies just as Dr. Melendez interrupts them. He asks Sean to elaborate on his idea for Gabriel's surgery. Dr. Melendez still thinks Sean's procedure has loopholes in the OR, but he and Sean do a practice surgery on a 3D image of Gabriel's heart. Claire searches for the specimen, but she still doesn't find it. Dr. Andrews comes in and says he wants to join in on the search. Jessica reprimands Claire for apologizing to Elizabeth and tells her they're out of time to save the specimen. Dr. Melendez and Sean continue to work on the 3D heart, and they succeed. Sean wishes him luck but admits he doesn't believe in it. The team informs Elizabeth that they don't know if she has cancer. Her options are either having a surgery she may not need, leaving her without speech, or doing nothing and dying. Gabriel's mother and Dr. Kalu bring Gabriel to the OR to begin his procedure. Dr. Claire looks on as Elizabeth sits in her room and reads a children's book to her daughter. Dr. Claire stops Elizabeth's surgery and asks for more time when she suddenly realizes there could have been a mismatched name on the specimen's label. Claire works with Carly again, hoping to find the specimen. Gabriel's surgery is successful, and Dr. Melendez informs Gabriel's mother. The latter is still tapping on the drum that his heart is beating just fine on its own. Elizabeth wakes up, and Claire informs her that the specimen was saved. Dr. Andrews also informs her that she doesn't have cancer. She hugs and thanks Claire. Aoki watches as Dr. Kalu and Dr. Melendez watch cartoons with Gabriel and his mother. Sean comes to see Dr. Glassman, who praises him for learning something new and mentions that he will learn faster when he finds a life coach. Sean is upset and asks if Dr. Glassman is giving up on him. Dr. Glassman admits he can't always be there, but Sean insists he doesn't want a stranger helping him and walks out. Claire congratulates Melendez outside while he waits for Jessica. Jessica soon joins Melendez and gives Claire the court papers from Elizabeth and her lawyers as the couple heads home. Leah and Sean get off the elevator, and he tells her she looks absurd in her sweater. She tells him she has applied and offers him one. Sean then follows her into her apartment. The next day, Dr. Andrews announces that a VIP patient with torn ligaments in his left arm will be hospitalized at St. Bonaventure. He has room for a few resident surgeons to assist him and Dr. Melendez. Sean mentions that he has never done such an operation before, and Dr. Andrew teases that the patient is a pro athlete. Dr. Kalu mentions 3 of them, so Dr. Melendez says whoever isn't on their team will be assisting Dr. Coyle on a double-leg fasciotomy. Dr. Andrews makes them pick a team, and Claire ends up with Dr. Coyle. Dr. Andrews and his team examine their patients' profiles. The patient is named Bobby Atto. Dr. Andrews mentions Bobby as a champion gamer, much to everyone's surprise. It appears that Bobby has torn the ligaments in his left arm from over-excessive gaming. Sean suddenly has to go. In Dr. Glassman's office, Sean sees the therapist hired to help him, Dr. Melissa Bourne. Melissa mentions that Dr. Glassman thought it would be best to meet her before their first in-home session, but Sean doesn't feel comfortable. He reluctantly agrees to have her assist him, but he walks out. Later, the team finally meets with Bobby, and Dr. Andrews assures him of proper care. Just then, Sean walks in and asks Bobby to squeeze his hands. As Bobby does, Sean can detect Bobby's condition with his photographic memory. Before Sean can complete his diagnosis, Dr. Melendez interrupts him and asks that they prep Bobby for surgery. As Sean leaves, Bobby calls him back. Bobby notices how the other doctors treat Sean like a noob and encourages him to stand up for himself, as it appears that they do not respect him. Dr. Claire is going through Dr. Coyle's patients' files. Dr. Coyle interrogates her for a bit and concludes that she is smart. He asks her to take the lead on the procedure for the patient. The patient's name is Hazel. Dr. Claire examines her swollen legs and warns that if they do not act quickly, the damage to her legs could be irreparable and she could lose her legs. Hazel panics, but Dr. Coyle assures her that they will save her legs. Dr. Coyle seems impressed by Dr. Claire. In the OR, Dr. Andrews and his team are operating on Bobby. Dr. Kalu praises one of Dr. Andrews' research papers. Sean compliments Dr. Melendez's hair and recommends that Bobby do a nerve conduction test, but Dr. Melendez objects. Dr. Andrews asks Dr. Melendez to hand over the rest of the procedure to Dr. Kalu to allow him the opportunity to show them what he can do. In Dr. Coyle's OR, Dr. Coyle talks through the surgery to ease the atmosphere, acknowledging that Dr. Claire is used to working with Dr. Melendez, who is always so serious. He tells her to be free, so she will make fewer mistakes. He encourages her to operate on Hazel's other leg and adds that the best way to learn is by doing it. Later, Sean contemplates taking the bus home and decides not to. Instead, he decides to sleep in the hospital custodian's closet late at night. Sean does this to avoid meeting with his therapist. Dr. Glassman sends him a text to remind him of his appointment, but he deletes it. Sean runs into Dr. Glassman, who worries that Sean is at an impasse in the morning. He's not happy that Sean avoided his appointment with Dr. Melissa. Dr. Glassman also mentions that Sean stinks, as Sean has not had a shower. Sean tells him that he will clean up in the doctor's lounge. Dr. Glassman tells Sean that Sean could have said no instead of depriving him of a good night's sleep and hygiene. Dr. Glassman tells him he's a grown man and can make decisions for himself. Dr. Glassman bribes him with the new surround system for his TV and asks him to meet with Dr. Melissa for 3 sessions. after which he can refuse to see her anymore, and Sean agrees. Dr. Coyle and Dr. Claire visit Hazel in her ward and assure Hazel that her legs could take time to heal, as she is worried about a possible amputation. Dr. Coyle seems to be attracted to Dr. Claire. He praises her skill, but Claire feels awkward. Later, Claire asks if Sean or Dr. Kalu would like to trade patients, as she feels Dr. Coyle is too friendly. Dr. Kalu says he wants to remain with Dr. Andrews because he lets him take the lead. Sean says he likes Bobby because he gives very good advice. When Bobby is awake, he's disappointed that Sean wasn't involved in the surgery. Sean decides to speak and tells Dr. Melendez that Bobby needs an MRI. Dr. Melendez refuses, despite Sean's persistence. Sean says Dr. Melendez doesn't respect him, and Dr. Melendez agrees that he doesn't at that moment. Dr. Kalu steps in and suggests that Dr. Melendez order the MRI, since Bobby is a pro athlete and could require extra attention. Dr. Melendez reluctantly agrees, and Sean hurries off. During the MRI, Bobby tells Sean to be more fierce if he wants to be respected, but Sean says he only wants to be a good surgeon. Sean talks about how he has to see Dr. Melissa to get a surround system. Bobby mentions that his parents made him talk to a therapist when he was younger, but he never told. Bobby tells Sean that doing whatever he wants is always an option. After the MRI, Sean and Kalu discover that Bobby has cancer that has spread to his brain, making additional surgery much more complicated. Bobby was diagnosed with cancer 3 years prior. Dr. Melendez grills Bobby on why he kept his diagnosis a secret, as it would have helped him better review his condition. But Bobby yells that if Dr. Melendez had listened to Sean, he would have known. Bobby says Dr. Melendez does not respect Sean, but Dr. Melendez insists he does. Sean intervenes, and Bobby admits that his cancer diagnosis affected his gaming. He would rather spend his days living rather than dying. Sean suggests they conduct a full body scan, and Bobby shows his support. Claire checks on Hazel, and Hazel opens up about how difficult her job has become due to harassment from her employer. Her sister suggests she quit, but Hazel doesn't want to. Suddenly, her heartbeat rises, and she pages Dr. Coyle. He insists that she handle the crisis, despite her reluctance. Claire is very uncomfortable around him. After a meeting with Dr. Glassman, Dr. Melendez learns that the tumor in Bobby's brain makes it inoperable. He breaks the news to Bobby. When Dr. Coyle and Claire are alone in Hazel's room, he makes unwanted sexual advances toward her. When Claire refuses, Dr. Coyle threatens her. Later, Dr. Melendez and Jessica have dinner with her father. Mr. Preston offers to pay for their wedding, so Jessica can quit her job and start a family, but the couple refuses. The situation becomes tense, and Dr. Melendez criticizes Mr. Preston as living off his father's money instead of contributing to society. He calls him a parasite. Mr. Preston leaves. Dr. Glassman confronts Sean about sleeping in the closet to avoid seeing a therapist. He suddenly realizes something and runs off. Claire talks to Dr. Kalu, whom she is having an affair with, about Dr. Coyle and yells at him for not supporting her and downplaying the issue. Later, Dr. Glassman tells Bobby he can remove the tumor if he wants part of his brainstem removed. The procedure would paralyze the left side of his body. Dr. Andrew warns him that the surgery will ultimately end his gaming career, but Bobby agrees without hesitation. Dr. Kalu then confronts Dr. Coyle and slams him against a locker in the locker room. Dr. Kalu physically threatens him and orders him to stay away from Claire. Bobby's surgery goes well, and Bobby reveals to Sean that he wasn't good at anything until he found video games and became the best in the world. He convinces Sean to stop telling people what he can and can't do. Later, Dr. Melendez apologizes to Jessica for his remarks and learns that she doesn't want children. Dr. Glassman confronts Sean in the hospital lobby and insists that he see Dr. Melissa. Sean has a meltdown and hits Dr. Glassman in the face. He runs out of the hospital. Dr. Kalu is fired for assaulting an employee, and Sean has suddenly disappeared with his things. Dr. Glassman goes to Leah's apartment to speak with Sean. Leah lies to him that Sean is not there, but Dr. Glassman doesn't believe her. Leah threatens to call the police as Dr. Glassman looks around. He gives up when he does not see Sean and hands her his card to reach out to him if she speaks with Sean. Soon after, he leaves. Sean was actually hiding underneath her bed. Sean wants to go back to work, but Leah advises him not to make decisions when he doesn't feel like himself and suggests that he take a break and go on a vacation. She decides to have Sean call in sick, so he agrees after a little hesitation. The two of them decide to go on a road trip. Back at St. Bonaventure, Dr. Neil Melendez is asked to assist with Dr. Andrews' separation surgery. Dr. Melendez insists that he's busy, but when Dr. Andrews shows him the patient's file, he becomes interested and agrees to team up. Dr. Melendez notices Sean's absence and asks Claire if she's seen him, but she hasn't. He shares the case of the separation surgery of a set of twins joined in the skull. Dr. Glassman approaches, and Dr. Melendez confronts him about Sean's absence. Dr. Glassman lies that Sean has informed him of his absence. Dr. Melendez and Claire visit the twins, while Sean and Leah pack for their road trip. Leah has 2 cars, so Sean is curious to know how she can afford 2 cars, and she tells him her grandpa willed his car to her when he passed. Dr. Andrews confronts Dr. Glassman about Sean's absence and cannot protect him forever. Meanwhile, Leah and Sean begin their road trip. Dr. Melendez and Claire encounter some issues during the transplant of the twins. Sean tells Leah he likes her and asks why she doesn't like San Jose. She says it's because everyone is so competitive. Sean opens up to Leah about how his brother died. His mean father killed his pets, so he and his brother ran away from home. His brother died after he fell off a train they played on and hit his head. Sean never returned home, and Dr. Glassman has looked after him since. Leah feels bad and tries to cheer him up with some music. Dr. Kalu confronts Dr. Coyle, whom he assaulted for sexually harassing Dr. Claire, whom he's having an affair with, and asks him to help convince Dr. Andrews to give him a second chance. Dr. Coyle says it's not his problem. In the OR, one of the twins, Jenny, starts to have heart problems. The doctors decide that they need to have the separation surgery to relieve the stress on Jenny's heart. Sean receives a voicemail from Dr. Glassman, and Leah makes Sean a deal. She says if he turns off his phone, she'll let him drive, and he agrees. Leah teaches him how to drive, and Sean impresses her with his driving. The twins decide to go ahead with the separation surgery. Leah has Sean burn rubber, but Sean loses control of the car and hits something. Sean freaks out, but Leah tells him that it isn't his fault. Katie changes her mind and tells Claire that she doesn't want to do the surgery anymore. Dr. Melendez and the doctors try to find a way to convince the girls to go through with the surgery. They elect Claire to talk to them. After the car incident, Sean and Leah go to a bar, and Leah gets Sean drunk. Sean learns Leah is an automobile engineer. Dr. Melendez asks Claire if she wants kids, and then opens up to her about his fiancée, Jessica Preston, not wanting kids. Dr. Melendez talks to Jessica and tells her that he's okay with not having kids if it means being with her. He tells her he'll do other things to make him feel like a father. Sean and Leah do a little bit of karaoke before heading back to the hotel. She teaches him how to end a date properly. She then asks Sean to kiss her. Sean kisses Leah nervously. She goes to kiss him again, but he runs into the room to throw up. Claire agrees to talk to the twins about the surgery, and Katie gets back into the surgery. The next day, Sean feels disgusted and sad that Leah will never kiss him again. Leah tells Sean that he has to get over being afraid of everything or living life. Claire confronts Dr. Coyle and threatens to convince Dr. Andrews to rehire Dr. Kalu. Either his career is destroyed or Dr. Kalu's is saved. The separation surgery is a success. Sean listens to a voicemail that Dr. Glassman left. Dr. Glassman is worried about him and wants him to return because Dr. Andrews is not on his side. Sean and Leah go to breakfast. Leah tells Sean that she's going to quit her job and move to Hershey. Sean gets up and leaves. Dr. Kalu receives a call from Dr. Andrews, who tells him he'll write a letter of recommendation on his behalf, but he can't rehire him as assault is something he cannot tolerate. After the twins' surgery, Dr. Melendez is worried because the twins haven't woken up from surgery yet. Meanwhile, Sean leaves Leah and goes to the bus stop to take a bus to work. He listens to the song Leah played for him earlier while he waits. Later, Jenny, one of the twins, wakes up, but the other is stuck in a coma. Jenny asks how Katie is doing, but Claire says that it's too soon to tell. Sean returns to work, and Dr. Melendez isn't happy how he lied about where he was. Dr. Glassman had told Dr. Melendez he was dealing with a personal crisis, but Sean says he went on a road trip with his girlfriend. Dr. Melendez asks Claire and Sean to do an angiogram on Katie, trying to find out why she's in a coma. Claire asks Sean about his road trip, and Sean says he kissed Leah. He also mentions that Dr. Glassman is mad at him. They realize that Katie is barely getting enough blood to her brain. Later, Dr. Glassman and Sean talk about him running away. Dr. Glassman asks if this trip with this girl helped him. Sean says yes, and that he'd like to give 2 weeks' notice. Jenny has a bad experience of being alone. Jenny panics because, for the first time, she doesn't have her sister to be there with her. Her mother shows up and consoles her. Meanwhile, Dr. Kalu tries to get his job back. Sean suggests a stent to help Katie. Dr. Andrews agrees, and Sean asks him to write a letter of recommendation. This leaves Dr. Melendez and the rest of the team puzzled. Sean helps the surgeon put the stent into the patient, but it doesn't work, so they abort the surgery. Later, they learn that Jenny needs a new heart, but they don't quickly realize because Katie's heart is doing all the work for Jenny. Dr. Melendez mentions that Katie is a perfect match, but he is against it since Katie is still technically alive. They decide to share their plan with the mother of the twins. She agrees to the surgery so that Jenny can survive. The mother is in tears and asks if it will be painful for Katie. Dr. Andrews assures her it won't. She says she'll tell Jenny that Katie died. Dr. Melendez writes Sean a recommendation letter and asks Dr. Glassman to sign it. Dr. Glassman is worried that Sean will not cope in another hospital, but Dr. Melendez says that either way, he will not stop Sean from doing what he wants. The hospital decides to settle concerning Dr. Kalu's case. Jessica thinks the hospital is racist towards Dr. Kalu's case, as Dr. Coyle is supposed to be fired for sexually assaulting Claire. Claire and Dr. Glassman run into each other in the elevator, and Claire talks to Dr. Glassman about Sean, who thinks Dr. Glassman is mad at him. Claire suggests Dr. Glassman signs the letter since it shows that Dr. Glassman believes in him. They proceed with removing Katie's heart, but Katie suddenly stabilizes. Sean suggests that the twins be reattached. Everyone feels frustrated because they had spent 40 hours separating them, only to join them again. The doctors believe that if they reattach the twins, they'll help heal each other. The mother of the twins speaks to Jenny about the doctor's plans, but Jenny is upset that they had tried to kill Katie. Jenny doesn't want to use Katie as a life support machine. Claire wants to put the twins back in the same room so that Jenny can see Katie really is gone, and Dr. Andrews agrees. Sean helps Leah pack and tells her he wants to have his own life, one that he controls. Sean doesn't want Dr. Glassman to help him, but Leah insists that Sean may need help. Sean then asks how he would know if he stayed. Dr. Melendez has a moment with Jessica. He tells her she's the only good thing about his day, but Jessica seems to be worried about something. In the morning, Jenny agrees to the surgery after realizing that Katie will always be with her wherever she goes, and the surgery is a success. Sean and Dr. Glassman finally talk. Dr. Glassman gives Sean the letter of recommendation and promises Sean that he'll back off and let him make his own choices if he stays. He tells Sean that he believes in him. Surprisingly, Katie wakes up, but the doctors don't know how. Dr. Kalu doesn't want the hospital's money, as he wants his job back. Claire asks Sean if he's moving to Pennsylvania because of Leah. Sean tells her Leah makes him happy, and Claire tells him she'll miss him. We learn that Jenny and Katie have to be separated again because Jenny is killing Katie, and Katie starts crying because Jenny's health suddenly deteriorates. Katie's heart cannot sustain both of them. Soon after, Jenny dies because her heart has nothing left to give. Katie refuses to separate from Jenny, but her mom painfully convinces her to let Jenny go. Dr. Kalu gets his job back, but at a cost. Dr. Kalu uses racism in his lawsuit against the hospital, and Dr. Andrews is not happy with them. The twins are separated, and their mother puts Katie, the surviving twin, to sleep. Meanwhile, Sean gives the letter back to Dr. Glassman and decides to stay. His conversation with Claire changed his mind. Jessica tells Dr. Melendez that she wants to break up because she wants him to have kids, but she doesn't. She assures him he will regret continuing with her, but he's too decent to think he won't. Jessica doesn't want to watch Dr. Melendez end up resenting her. Jessica assures Dr. Melendez that he will be a great dad. Later, Leah gives Sean the baseball they packed earlier. She is ready to leave. She tells him to bring the baseball to her when he visits Hershey. He tells her he likes Hershey because Leah is there. Leah and Sean embrace. She tells him that he's a good doctor before she kisses him and leaves. Sean puts the baseball on his dresser right next to the picture of him and his brother. Sean is set to leave for work and knocks on Leah's door on his way out. At the dining hall, Sean has to eat alone. It appears someone is supposed to have breakfast with him. At the hospital, a patient is wheeled with his wife and her son walking behind. The child and mother are panicked, but she tries to calm her son. It appears that the patient has suffered a stroke. While on rounds with Dr. Andrews, Sean asks if Dr. Kalu and he were being punished. Dr. Andrews angrily walks away, and Dr. Kalu cautions Sean. The trio visit a patient, a girl with a burn on her arm. After Sean reads out the procedure for her treatment, she suddenly starts to have chest pains, but her vitals remain the same. Sean remarks that this could be an interesting case. In Dr. Lim's OR, Dr. Claire assists in surgery on a stroke patient who had an aneurysm. She learns that Dr. Coyle, who harassed her, got a new job and got a raise. The news shocks her. Sean becomes suspicious of Dr. Andrews' patient when he confirms that she didn't have a heart attack. However, the scans did show that her lungs were inflamed. He tells her a procedure will be carried out on her and gently pats her. The patient tells Dr. Kalu not to touch her unless medically necessary. Sean is still skeptical of the patient's story and doesn't believe anything she's telling him, but Dr. Kalu dismisses his worries. Dr. Claire goes to the director and asks why they didn't fire Dr. Coyle. The director tells her that their stories didn't match, and Dr. Kalu's assault on him kept her hands tied. She says she cannot do beyond what she's already done because she has no evidence. This hurts her, and the director says she's open to any suggestions she may have concerning the case. Dr. Lim tells the stroke patient's family that he will be okay. Claire comes and tells her that they found another aneurysm as she leaves. The team do a bronchoscopy on the burn patient. Dr. Kalu notices Dr. Melendez's reaction to his presence and tells him he's not sorry for what he did and that he believes he has a lot to learn from him as a mentee. Dr. Melendez ignores him, and Sean asks if he's indifferent because of his breakup with Jessica. He ignores the question, and Sean assumes the experience is traumatic for him. The scope breaks through the bronchial wall, and they hurriedly prep for surgery because she's hemorrhaging. Sean keeps asking Dr. Melendez why he's too hard on Dr. Kalu, as he is not incapable of making mistakes. He asks what mistake he has made, and we learn that Dr. Melendez has punctured the patient's bronchial wall. Sean goes to see Dr. Glassman. He asks where he was since they always have breakfast on Mondays. Dr. Sean also asks Dr. Glassman if he should report Dr. Melendez for having punctured the patient's bronchial wall, as he's worried that he will treat him the way he's treating Dr. Kalu. He hesitates and then resolves to tell Sean to make the decision for himself and any other decisions he has to. This leaves him puzzled. Dr. Andrews and Dr. Lim discuss what to do about the stroke patient. He suggests that they ask Dr. Coyle to help with the surgery, but decide against it. Claire's against it, but Dr. Lim says they have to think of the patient. She still doesn't give in and insists that if Dr. Coyle is let off the hook because he's the best surgeon for the job, he will do worse. Dr. Lim has to decide who matters most between himself and the hospital staff. Later, Jessica Preston asks Dr. Melendez if he accidentally hurt a patient because of their breakup. He lies that he's fine and says he wasn't distracted and did not screw up. Sean asks the burn patient why she lied about inhaling smoke, and she says that she was just confused. She suddenly starts to throw up. Claire and Dr. Lim talk to Tessa about the paralyzed patient and how her husband needs surgery or else he will die. Dr. Lim mentions that there will be significant brain damage should the surgery be successful, but he will remain alive. Tessa decides not to consent to the surgery as her husband wouldn't want to live a compromised life. Claire and Sean have breakfast together, and he wonders why people lie without reason. He realizes she's not interested in the conversation and decides to eat alone. She apologizes and they discuss Claire's patient. He learns that Tessa doesn't want to consent to the surgery. She insists that Tessa loves her husband because she can read people, but Sean says reading people is biased and more concerned about actions. He says that you will do anything to prevent their death if you love someone. Dr. Melendez and Jessica talk about how he screwed up. He admits he's upset because Jessica believes Sean over him. She suggests someone else from legal should investigate him, and he agrees, but he refuses to admit that the puncture was his fault. Claire confronts Tessa. She asks if Tessa loves her husband enough to let him go or hates him enough to let him die. She opens up about her harassment from Dr. Coyle and asks what Tessa's husband did to her. Tessa wants to just let him die so that her son can have a good memory of his father. It turns out she is a victim of domestic violence. She insists that her husband dies. Sean hypothesizes that their patient could be a terrorist because she's a Muslim and because of the presence of ethanol in her body, and there are no other possible explanations for the discovery of ethanol in her system. Dr. Melendez doesn't agree that she's a terrorist because she's Muslim. Sean thinks she's lying and may be involved in the mass production of chemical weapons, but Dr. Melendez believes that the patient is probably afraid. He also warns Sean that unfounded speculations can destroy a person's life. Claire tries to convince Tessa by threatening to go to court. She's afraid for her life, but she signs the consent form when Claire regretfully insists. Claire suggests that she leave her husband instead. Sean confronts his patient about being a terrorist, but she ends up having a heart attack. Dr. Melendez talks to a lawyer about the accident with his patient. Claire and Dr. Lim perform the surgery on Tessa's husband, but she ends up having to terminate the procedure due to his BP skyrocketing. They need to figure out what they missed. Sean and Dr. Kalu have opposing views on how to treat the patient. Sean suggests steroids, but Dr. Kalu suggests antibiotics. Dr. Kalu believes a fourth party should be consulted. Dr. Melendez feels insulted, and Sean tells him he's arrogant. Dr. Melendez decides to put her on antibiotics. Meanwhile, Claire accuses Tessa of trying to kill her husband by filling his capsules with sugar. But when she seems innocent, they come to the conclusion that the son might have done it. Dr. Melendez's patient's vitals end up spiking, so Dr. Kalu switches from antibiotics to steroids. Sean says he should thank Dr. Kalu for saving her life, and he hesitantly thanks him. Sean knocks on Leah's old door and meets his new neighbor. Claire tells Tessa that the surgery went well, but she and her son are gone. Sean, Kalu, and Melendez learn that their patient was using ethanol to create perfume, and Sean learns that people lie to protect other people. In the hallway, Dr. Melendez and Jessica run into each other and talk about their relationship, and he opens up about being affected by the breakup, but that being a good surgeon doesn't make him a good husband. Claire meets up with Kirsten, another woman who worked with Dr. Coyle. Kirsten was also sexually harassed, and Claire wants them to work together. Sean talks to Dr. Glassman about having breakfast and needing a friend, but he says he can't be his friend. Sean begins to cry, so he leaves. He goes and buys a pine tree air freshener to remember Leah. It's a new day at St. Bonaventure Hospital for all of our residents, and Dr. Lim introduces a new resident to the team, Dr. Morgan Resnick. After introducing each other, Dr. Lim suggests to Dr. Melendez that they should pick their own residents and have a little wager over who gives the best patient care. He's hesitant, but he agrees. Sean and Dr. Kalu end up with Lim, while Claire and Morgan are with Dr. Melendez. Sean and Kalu have a young girl called Quinn brought to the hospital by her grandmother. Quinn is presented with possible appendicitis, but they discover that she's a boy who identifies themselves as a girl. Sean struggles to get his head around it. Claire and Morgan have a father who has been taking lots of unprescribed medications to fix himself. He's a teacher and a single father. Howard needs to be operated on, but the father does not want to leave his kids for too long. The resident discovers his appendix has unfortunately ruptured, requiring immediate surgery. During that surgery, Morgan clarifies to Claire that she's not here to make friends. She's here to be the best because Sean will definitely be selected at the end of the residency since he's Dr. Glassman's mentee, and Dr. Kalu's assault on Dr. Coyle ultimately leaves him out of being selected. In the end, Morgan wants to stay. For Morgan, when Claire wins, she loses, and she will not let that happen. Claire says she's awfully cynical for someone so young. Dr. Andrews and his wife, Isabel, has sought out professional help from a fertility expert. He's worried that they've waited too long to try, and they're hoping for some good news from this specialist. Isabel is worried that he resents her for picking her career over wanting to have children. Dr. Andrews does blame her for their infertility, but he does not resent her. Test results return for Quinn, and she doesn't have appendicitis. She has testicular cancer. Dr. Kalu and Sean assure her that contracting it early means that treatment is possible, and she's unlikely to die. A condition for her bone density has also been detected. Their investigation reveals that she's been using puberty medications. Quinn was also diagnosed with low bone density. Quinn's grandmother, Ruth, discovers that neither her granddaughter nor her parents wanted her to find out about the medications because she believes Quinn is only going through a phase and does not support her granddaughter's transgender status. Treatment options are drawn up. When Quinn's parents arrive, they discuss her options, but Ruth is still not in support. Surgery will be required on the cancerous testicle, and medication will need to be stopped. This raises concerns with Quinn, who's worried she will go back to being a boy. Quinn doesn't want this to happen, but there are no other possible options. Sean then suggests removing both testicles. With both removed, it would prevent the buildup of testosterone to ultimately turn back into a boy. By this point, the grandmother is not happy at all. She has had enough and files a case of child abuse against the parents in an attempt to put a stop to everything. She's struggling to accept that she is indeed trans. Ruth threatens to contact Child Services if her daughter and son-in-law proceed with the bilateral procedure. The results for Andrews and his wife are back. And it's not good news. The experts say Dr. Andrews has a low sperm count. The specialist refers him to a urologist, and Isabel reminds him that they'll get through this together. Other options and treatment may need to be considered. Sean is at home watching TV, and Kenny walks in, freaking Sean out a little bit. Kenny sits down and asks Sean questions about his job and life. Kenny sits in the chair watching the TV too. Howard is out of surgery and needs to rest up, but he's not keen on staying. He desperately wants to get home to his kids. After his wife passed away, he has never left them alone. His symptoms get rapidly worse before they can even discuss options. They discover he has contracted a superbug. Howard's body has become resistant to all antibiotics due to the excessive amounts of medication he takes. Ultimately, he can no longer fight infection. Dr. Melendez informs him they will have to form a colostomy on him, and he would have to use a colostomy bag, most likely for life. Dr. Glassman holds a meditating session for the parents and Ruth to allow them to speak openly and hopefully come to a decision on her treatment. Quinn's parents forced her to present herself as a boy in public, but Quinn became so reclusive and hated herself so much that she almost committed suicide a year ago. Claire comes up with a plan B for Howard, a fecal transplant delivering healthy bacteria to the body. That way, he could avoid surgery altogether, but it is still experimental. She and Morgan manage to convince Melendez to try, and Morgan tells Claire that she will be the only doctor who can handle the feces when it arrives at the hospital. The mediation between Quinn's parents and grandmother continues, but time is running out as Quinn's condition gets so bad that the time for discussion is over. Dr. Andrews informs them that she needs emergency surgery. The parents decide to only remove the one testicle, just in case. Sean takes the time to really try to understand Quinn. He asks questions about when she began to feel like a girl. The surgery gets underway, and it goes well, but Quinn begins to rapidly decline. Dr. Kalu discovers that internal bleeding is the likely cause. Sean supports him, and Dr. Andrews has to cut her open again. Dr. Kalu was spot on with this. After Howard's surgery, Dr. Melendez is impressed with Claire, who intends to write about the procedure and submit it for publication. Morgan wants to assist with it. Dr. Melendez, impressed with her paper, suggests Claire should read it too. When Quinn wakes, she learns that her parents did not do what she wanted and only removed the cancerous left testicle instead of both. Andrews tries to take the blame as she is not happy. He says Quinn may never know, that she might want to have a child one day. Quinn says she'll be back when she's 18 to remove the other. With both sets of patients treated and in good hands, satisfactory patient scores arrive, and Dr. Lim congratulates Morgan and Claire. Dr. Lim hands Dr. Melendez the wager she promised him. He plans on framing it. Sean and Dr. Kalu agree that they also make a great team. As Quinn is more of a purple girl, Sean stops Ruth from going into her room with pink flowers. Dr. Melendez asks Claire if she read Morgan's paper and tells her he wants her to read it to know what she's up against. He wants her to rise up. Outside, Dr. Glassman tries to talk with Sean, who begins to walk away, even after he offers to drive him home. Sean does so since Dr. Glassman said he couldn't be his friend. At his apartment, Sean knocks on Kenny's door, asking for his help. Kenny opens the door to the pool, and Sean just floats. He wants to understand the feelings Quinn talks about. Sean is on a bus. He doesn't feel comfortable, but a text from Leah makes him feel better. She's thinking about him and the pine trees. Sean arrives at work and learns about a fundraiser gala in the hospital lobby. Sean and the other residents talk about the gala, but Sean doesn't like parties. Dr. Melendez tells them that all residents are expected to attend the fundraiser and make donations. A new resident joins Melendez's group, Alex Park. He's the last of Dr. Coyle's residents and was formerly a police officer. Sean asks how old Dr. Park is and learns that he's older than Dr. Melendez. Dr. Melendez apologizes for Sean's inappropriate questions and explains that Sean is a gifted doctor with autism. Dr. Park takes no offense, and Morgan thinks Dr. Park is modest when he remarks that he's a late bloomer. Later, Sean and Morgan are assisting Dr. Lim with a patient whose heart is outside their ribcage. The patient is Spirit. She makes a video of herself and the residents to keep her friends updated on her surgery. Sean learns that Spirit likes crowds and is curious to know how she made friends, since she mentioned that she hasn't really been in crowds and cannot do fun things with anyone because of her condition. Spirit says she likes to talk, but she's restricted to talking online. Sean and Morgan also learn that she's never hugged anyone because it's risky. Claire, Dr. Park, and Dr. Kalu's patient is a young boy who needs a new liver after rejecting the first one. His name is Eric. The residents believe that it will be difficult to find him a match because of his blood type. but Dr. Melendez insists that they search as it's the only way to keep him alive. Allegra Aoki asked Aaron Glassman to ask Aidan Coulter to be the keynote speaker at the gala, as the intended keynote speaker had cancelled. Dr. Park and Dr. Kalu are preparing Eric for his procedure. Dr. Park plays Eric a song from his favorite sports star, but Dr. Kalu is curious to know how he knew that, so he asks and learns that Dr. Park went through Eric's personal belongings. Morgan and Sean run tests on Spirit. Morgan advises them to buy an expensive tux for the gala. They realize that Spirit has an enlarged heart, which prevents them from performing surgery. Claire searched beyond the official transplant list and found an independent donor online. The bad news is that the donor is an imprisoned Russian hitman named Boris, charged with 7 murders. The hospice board debates the risks of letting Boris out of prison. Claire, Alex, and Kalu get approval to use the convict's liver. Dr. Lim informs Spirit that she'll have to wait until she's 18 to do the surgery because of her heart, but Spirit wants the surgery done now. She's tired of being lonely. Dr. Park and his team prepare for Boris's arrival, but Dr. Park is skeptical about Boris's intentions, as he suspects Boris is only looking for a way out of prison. Dr. Kalu and Claire talk about going public with their relationship. Meanwhile, Eric doesn't want a murderer's liver. Dr. Melendez orders more restraints, as he believes Eric will be uncooperative during the liver transplant. In Dr. Lim's office, Morgan proposes trying an experimental procedure on Spirit, despite Sean being against it. Sean feels the procedure is risky and irreversible if it doesn't go as planned, but Morgan suggests he's biased. Sean confronts Morgan about being competitive and wonders if she's trying to undermine his confidence or make Dr. Lim think he's biased. She insists that she's only trying to help both Sean and Spirit. Aoki meets with and convinces Aidan, who doesn't like to give speeches, to be the gala keynote speaker. She says he should tell a story about his success and loyalty to the city of San Jose instead. She secures Aidan as the gala keynote speaker and believes there's a spark between them. She confides in Dr. Andrews, who advises her not to explore it, as it would be bad for her if Aidan thinks she's using sex to receive more donations for the hospital, especially since he is one of the hospital's biggest donors. Boris is let out of prison and restrained in the hospital. Dr. Park and his team question his intentions, but Dr. Park is not convinced. Eric struggles with the doctors as he's adamant about Boris's liver. Morgan pressures Sean to buy a tuxedo for the gala. He goes to Dr. Andrews for advice. He mentions how stylish Dr. Andrews looks and wonders if his looks make him a better surgeon and attract friends. But Dr. Andrews advises Sean to rent a suit instead. He asks if Sean had asked Dr. Glassman about it, but Sean says he makes his own decisions now. They begin the surgery on the convict, but he has an allergic reaction to the anesthetic, so they can't operate. Boris insists that they do the surgery again, and Claire says they can't. This upsets the convict, who escapes during the walk back to the transport. He grabs an officer's gun and shoots himself in the head. Claire is traumatized. Dr. Andrews notifies Eric's parents that he has only a day left to live if they cannot find him a new liver. Dr. Park suggests that the doctors salvage Boris's organs and save multiple lives, as he's already dead. Spirit surgery is a success, but Sean learns that Morgan doesn't respect him during it. Later at the gala, Aidan approaches Aoki, and they discuss going golfing, and he asks her to dance. Aoki seems really attracted to Aidan, and it would appear that the feelings are mutual. Claire talks Eric into accepting the convict's liver, and Eric is taken back for surgery, where he's given a new liver. Eric's surgery is a success, and he asks Dr. Melendez if he can send the convict's parents a thank you card. Sean shows up at the gala, where Morgan tells him to mingle. Instead, he leaves the party and returns to Spirit's room, where her friends talk to her. Claire and Dr. Kalu show up together at the gala. Dr. Kalu believes he and Claire take their relationship public by attending the gala as a couple. Dr. Kalu gets mad when Claire doesn't remember the song that played when they first kissed. She blamed her forgetfulness on having a long day and is still not over the trauma of watching a man shoot himself in front of her. But Dr. Kalu misunderstands her and concludes that she doesn't love him. He breaks up with her. Sean returns to the party and approaches a table of doctors. They introduce themselves, and Sean is about to leave when Dr. Andrews arrives. They talk about golf, and he begins to loosen up. The next day, Sean tells Claire and Dr. Park about his outing with his neighbor Kenny. Sean was made to pay for tickets for both Kenny and his girlfriend. This worries Claire. Just then, Dr. Melendez arrives with information about a new patient who has severe neck pain. Dr. Melendez and his team examine Hunter when Sean asks why his wife married him despite his confinement to a wheelchair. Hunter suddenly cannot feel his legs. In the hallway, a woman sings for the crowd gathered to watch her. We learn that this woman is Claire's mother, and Claire isn't excited to see her. Dr. Andrews examines their patient who has contracted an infection from an implant. Sean and Dr. Park want to know about Claire's estranged relationship with her mother, and she tells them her mother is a lot of things, but not great. Morgan talks to Dr. Kalu about a possible career opportunity, and he tells her he doesn't need her help and insists he fought to stay at the hospital. Dr. Melendez thinks Hunter will walk again after he examines his scan results. Dr. Andrews tells his patient that he has treated the infection from her transplant, but he still needs to monitor her. Sean and Hunter talk about his excitement over the possibility of walking again. Hunter believes that people waste time and energy proving that they belong. Dr. Andrews talks to a fertility specialist about his inability to have kids and the possibilities of what he can do. Morgan examines Dr. Andrews' patient's body. The patient is annoyed with the pushing and the prodding, but Morgan finds a blemish and pushes on it. It hurts, the patient tells her. Morgan leaves to call the attention of Dr. Andrews. Morgan lies that Dr. Kalu found the blemish, and Dr. Andrews informs her that he'll have to remove all the implants, but she doesn't want it. She would rather try a broad spectrum of antibiotics. Dr. Andrews tells her she could become septic, but she doesn't care. Dr. Melendez and the team discovered a cyst that's done growing and shouldn't cause any issues for the patient. Hunter will not walk, but Dr. Melendez advises him against surgery. He wants to know what his odds are. Later, Hunter lies in bed with his wife. He tells her that he wants to live a normal life. Dr. Melendez meets with Hunter and his wife, and the couple argues. She thinks he's gambling his life away, and she leaves. Claire's mother wants to talk. She admits that she's sick, but she's better now. She wants a second chance. Sean tests Hunter's fitness for surgery. Sean asks him if he's the same person he was before being stuck in a wheelchair. Sean tells him if he does walk again, he'll not forget the lessons he learned. Dr. Andrews informs his patient that the antibiotics are not working and she needs surgery, but she insists she doesn't want it. Her husband Barry tries to talk her into it. Dr. Melendez finds Hunter's wife in the lobby and assures her that her fears are valid. Later, the team talks about Hunter's odds and whether he should have surgery. Sean mentions his new friend and neighbor, Kenny. Dr. Park tells him that Kenny has a record as he looked into him. Jessica confronts Barry and asks him to assure his wife that he's faithful to her. Hunter's wife returns to his room and tells him she's scared he won't need her if he walks again. He reassures her, and Sean tells Hunter what he said was nice. Barry goes to see Emma to convince her she needs surgery. She thinks he cheated on her before because of how she looked, but he confesses he never cheated and hid a gambling addiction. Sean tells Claire how great she is. He asks her if she would date someone with a disability, and she says yes. Everyone is called to the OR for Hunter's surgery. Claire keeps thinking about her mother and what Sean said. Hunter changes his mind for a second, but his wife reassures him. Emma is under surgery, but she suffers a septic embolism. They lose her. Meanwhile, Dr. Melendez experiences complications in Hunter's brainstem. He begins to die. Barry says goodbye to Emma, and the team meets with Hunter, whose surgery was a success. That night, Dr. Andrews talks to his wife and tells her he wants to give her kids. He mentions the surgery he can have, so she tells him there are plenty of ways to have kids. Claire and her mother talk over coffee. Claire leaves in tears after her mother borrows some cash from her. Meanwhile, Sean comes home and Kenny is in his apartment. Sean has begun to doubt Kenny's intentions because of his record. Kenny bought Chinese food and wants to play Mortal Kombat, and Sean hesitantly agrees to play. Sean finds a glass of milk and a letter from Kenny outside his apartment. In the letter, Kenny thanks him for always being there for him. Back at the hospital, Sean, Dr. Andrews, and Dr. Park meet with Gretchen, who has Mobius syndrome. She and her father, Mr. Millman, hope an elective surgery will give her the ability to produce facial expressions, especially a smile. No one can tell when Gretchen is happy or sad, as she cannot express any emotions. Gretchen makes a joke, and Sean asks if she wants to be a comedian and adds that people getting her jokes must be important to her if she's ready to risk dying during elective surgery. Sean questions the importance of the procedure. Mr. Millman is unhappy with Sean's comments, and Dr. Andrews apologizes on his behalf. Dr. Andrews assures Mr. Millman that his daughter is in proper care. In the meantime, Dr. Melendez, Morgan, and Claire treat a patient named Lucy who has a post-op infection. Lucy hasn't been using her prescriptions, and now her condition is worse. Sean avoids Dr. Glassman in the lobby while buying an apple, but Dr. Glassman reaches out and tells them they can still talk since they're colleagues. Sean asks if he has a new friend and tells him about Kenny. Sean notices Debbie, the cashier, is flirting with Dr. Glassman as she has handed him an extra $1 in change. She smiles at Dr. Glassman. Sean and Gretchen talk, and Sean tells her he doesn't want people reading his emotions. Gretchen tells him that's what most people do with friends, and he looks away. Gretchen asks if the surgery is risky, so Sean lists the possible risks and adds that the procedure is expensive and medically unnecessary. Morgan thinks Lucy is a parasite, but Claire believes she's not. When they return to the ER, they find it empty as Lucy is not there. Gretchen doubts the surgery and tells her dad she no longer wants to do the surgery. Dr. Andrews confronts Sean, whom Gretchen claims have talked her out of the surgery. Dr. Andrews thinks Sean doesn't want Gretchen to ever smile and explains to him that smiles are healthy and contagious. He orders Sean to talk her back into it and bring Dr. Park along. Dr. Kalu and Celeste are reunited. Some episodes ago, she suffered a serious burn, and Dr. Kalu applied tilapia scales as part of an experimental procedure that would allow her real skin to grow back over time. Celeste is back for a consult and asks Dr. Kalu when she can remove the tilapia skin. He says she can have it taken off the next day, and she becomes nervous about how she'll look. He assures her that she was going to look beautiful, and there's an obvious attraction between the patient and her physician. After some coaxing from Dr. Andrews, Gretchen reveals Sean didn't talk her out of the surgery, but had inspired her. Dr. Park suspects that she's lying. She changed her mind because the procedure was very expensive and not covered by insurance. Claire learns that Lucy has returned, but when they meet her, they discover the woman they treated was not really Lucy, but an imposter. The real Lucy complains of shingles and asks for pain medicine. Claire tells Morgan that they cannot give her any medicine because they're already creating a Lucy, albeit an imposter. Dr. Andrews visits the insurance office in person and persuades them to cover Gretchen's surgery. He convinces the owner that facial expressions are a function. Sean visits Dr. Glassman in his office and tries to test Dr. Andrews' theory that smiles are contagious, but Dr. Glassman doesn't think they are. Sean tells him he wants to show him something and leads Dr. Glassman to the cafe. He matchmakes Debbie and Dr. Glassman as Sean feels he needs a friend. Gretchen agrees to go forward with the surgery. Meanwhile, the imposter returns and goes into septic shock. They report her condition to Dr. Glassman, who tells them to maintain the pretense, but the hospital will press charges when the imposter recovers. Celeste returns to the hospital to have Dr. Kalu check her tilapia skin grafts. He removes them and tells her she's beautiful. Through research, Morgan and Claire discover Lucy is addicted to pain pills, and her case of shingles was a cover. Sean checks on Gretchen, who does not appear to wake up from anesthesia. The doctors conclude she's brain dead. Dr. Glassman and Debbie have an awkward first date, but they discover a shared interest in cars. Dr. Kalu realizes he has feelings for Celeste and confesses to Sean. Dr. Park develops a hypothesis that Gretchen may have an extremely rare deficiency, leading to a long wake-up time. Dr. Andrews tells him not to tell Mr. Millman. The imposter's condition worsens rapidly, and all her organs are failing. She eventually reveals her true identity to Claire. Claire learns her name is Beatrice. Morgan confronts Lucy about her addiction and talks her into going to rehab. Meanwhile, Dr. Park's hypothesis is correct, and when Gretchen awakes, she smiles. Everyone is thrilled by the result of her surgery. Dr. Kalu takes Sean's advice. Since doctors are not allowed to date their patients, Sean agrees to take over Celeste's case so she and Dr. Kalu can begin seeing each other. Beatrice flatlines, but Morgan and Claire ultimately elect not to try and revive her as there is nothing left to save. As Dr. Kalu prepares for his date with Celeste, he receives an acceptance letter from a medical school in Denver, Colorado. That night, Sean arrives at Kenny's apartment for pizza night, but Kenny's friends show up unexpectedly. Kenny borrowed Sean's TV, but refuses to let Sean in, citing Sean's quirks are uncomfortable. Kenny takes the pizza for himself, and Sean is hurt. Dr. Glassman and Debbie go to a restaurant together for their second date, and when Dr. Glassman tries to ask for the check, he repeatedly asks for a doorstop instead. A panicked Debbie asks the waiter to call an ambulance. Sean tells Dr. Glassman that he wants to be his friend again and insists that he needs a friend more than he needs space. Sean tells him he's a great mentor and a good friend, but learns Dr. Glassman is dying. He has 12 to 18 months, and he doesn't want Sean to tell anyone. Dr. Glassman learns that he has a tumor, and Sean tells him he needs a second opinion. Dr. Glassman proves stubborn, but he urges him to see someone else. Dr. Kalu and Dr. Lim examined Caden, a patient with a dislocated ankle. He's drunk and in pain. He heads into surgery with Dr. Melendez, who keeps him awake because of a possible concussion. His heart rate suddenly falls. Sean works on his dry erase board, but he is upset as he suddenly searches for something. Dr. Glassman comes in and tells him he's explored it all. Sean tells him he needs to go back to work. Dr. Kalu comes out of surgery to ask Blake, Camden's friend, what really happened. Blake confesses that he ate detergent pods during an initiation ceremony. Back in surgery, Sean and the rest of the team finish up. Dr. Melendez makes him lead. He has an epiphany and announces that he lost something, but he knows where it is now. He leaves surgery and heads to see Dr. Glassman. Sean has lost his scalpel that his brother Steve gave him as a gift when he was young. While he looks, he tells Dr. Glassman that he needs to get more imaging and a DTI scan. Sean talks to Jessica about Dr. Glassman's condition and asks her to talk to him as he won't listen to Sean. Morgan believes that Sean may have made a mistake during Caden's operation as he was distracted. Dr. Melendez says it was not a physician error, and Claire defends Sean. Dr. Melendez reports to Dr. Glassman about Sean's patient. Dr. Melendez doubts the possibility of Sean's error, as he's never had issues in the OR. He, however, wants to know what's going on with him. So Dr. Glassman tells him he has a brain tumor, and that must have been what distracted Sean. Dr. Park and Dr. Kalu go over to the drunken teen's file. They think he may be on drugs, so they ask Blake, who confesses that they're both on Molly. Jessica confronts Dr. Glassman and talks him into getting a second opinion. Dr. Andrews asks Dr. Melendez about Caden and why he left 3 first years unattended. He says they do this all the time, and Dr. Andrews hopes that Caden pulls through. Sean goes with Jessica and Dr. Glassman to see a different doctor. The first doctor was wrong, and he has the most aggressive form of brain cancer. She adds that he only has 3 to 4 months to live. Sean and Dr. Glassman zone out in sadness. The team now thinks Caden has a bacterial infection. Meanwhile, Sean cannot stop trying to come up with a solution. He's become hysterical as he writes theories all over the office. Dr. Glassman yells at him to stop. He tells Sean that he doesn't want to think about the tumor and starts crying and throwing things. Dr. Glassman wants to have fun and asks Sean to come with him. When his heart rate plummets, Dr. Melendez and the team rush Caden into surgery. Meanwhile, Sean and Dr. Glassman are at a carousel. He tells Sean about his daughter. Sean confesses that he's lost his toy scalpel. Sean gets a page and gets off the carousel. Dr. Melendez and the team rule out the bacterial infection since he isn't reacting to antibiotics. Sean confesses that he accidentally squeezed the artery during surgery and then runs to Dr. Glassman's office. He thinks he has a solution, but Dr. Glassman has accepted his fate. Sean mentions a biopsy can be done through his nose. Sean says he cannot die too. The team debate on whether to support Sean or not. Dr. Kalu suggests reporting the incident, but he will take responsibility instead of Sean. Dr. Melendez refuses and says the team will face the consequences together. Sean comes up with an idea to save Caden, and Morgan believes Sean's idea will work because he makes saves no one would have thought of. Dr. Andrews looks into Dr. Glassman's promise that Sean will remain excellent at his job. If he fails to, he will resign as president of the hospital. Sean will be relieved of his residency at the hospital. In surgery, Sean feels Dr. Melendez or the team should not be responsible for the outcome of his idea if it fails, but Dr. Melendez believes they should work together. He wants to take the team out after. Dr. Melendez tells Morgan that she will have someone killed at some point in her career, and he hopes anyone will still believe in her. Sean goes to see Dr. Glassman and notices a Band-Aid. Sean learns that he had the biopsy and could survive. He only needs surgery and chemo. Sean is thrilled and hugs Dr. Glassman. They then head to Dr. Andrews' office to confess that Sean made a mistake in surgery. Jessica says Sean has been an excellent surgeon and believes Dr. Andrews would use his mistake to have Sean and Dr. Glassman fired. Sean tells Dr. Glassman he loves him more and that they're friends. That was all from the video. I hope you liked it. Subscribe for more content like this and hit the like button to help us out. Also, leave a comment if you want us to recap your favorite movie. Until next time, take care.